Good evening, everyone. Good evening. Please have your seats. We're going to get started. Good evening, everyone. It is 6:00 p.m. on Tuesday, June 14th, 2022. I'd like to call the meeting of the Peoria City Council to order and welcome everyone in our council chambers, as well as Brady Johnson and our listening audience at WCBU. I'd also like to welcome the audience watching via cable channel 22. Madam Clerk, council mics are open. Can you please call the roll?
Mayor Ali.
Present.
Councilmember Allen. Councilmember Sear. Councilmember Graham.
Here.
Councilmember Jackson.
Here.
Councilmember Jensen. Councilmember Kelly.
Here.
Councilmember Euler. Councilmember Riggenbach. Councilmember Ruckriegel. And Councilmember Valpula.
Present.
We have a quorum present, Madam Mayor.
Thank you very much. Please join me, everyone, and stand for a moment of silent prayer or silent reflection, followed by the Pledge of Allegiance. Madam Clerk?
We are at proclamations.
Okay. We have 3 proclamations today. The first 2 are issued by the City of Peoria, and the first is committed to Pride Month. Whereas the City of Peoria, Illinois recognizes and proclaims the month of June 2022 as lesbian, gay, bisexual, transgender, and queer LGBTQ+ Pride Month. And whereas on June 28, 1969, the riots at the Stonewall Inn in New York City are acknowledged as the beginning of the LGBTQ+ rights movement. During Pride Month, we remember the events of June 1969 and celebrate and honor our LGBTQ neighbors, friends, and family. Whereas the City of Peoria celebrates diversity and is committed to supporting visibility, dignity, and equality for LGBTQ+ people in our community. And whereas LGBTQ+ individuals have made immeasurable impacts to the cultural, civic, and economic successes of our country. Whereas celebrating Pride Month influences awareness and provides support and advocacy for the City of Peoria's LGBTQ+ community, and is an opportunity to take action and engage in dialogue to strengthen alliances, build acceptance, and advance equal rights. The City of Peoria supports the rights of all citizens to experience equality and freedom from discrimination. Now, therefore, I, Rita Ali, Mayor of the City of Peoria, Illinois, do hereby proclaim the month of June as Pride Month in Peoria, Illinois. This next city issue proclamation recognizes Juneteenth. Whereas Juneteenth, also called Emancipation Day and Freedom Day, commemorates the traditional observance of the end of slavery in the United States. It is observed annually on June 19th. Whereas on June 1st, 1863, President Abraham Lincoln issued the Emancipation Proclamation to end slavery in the United States. And whereas more than 2 years passed before the news reached enslaved black people in Texas, on June 19, 1865, Union Major General Gordon Granger and his soldiers arrived in Galveston and spread the word that slavery had been abolished. And whereas Juneteenth is a day for all of us to reflect on what has happened since 1865 and to celebrate the social, economic, and cultural contributions of African Americans in the United States. Whereas on June 16, 2021, Governor J.B. Pritzker signed House Bill 3992, naming Juneteenth as National Freedom Day and designating it as a state holiday. Whereas on June 17, 2021, President Biden signed legislation into law establishing June 19th as Juneteenth National Independence Day. And whereas Juneteenth is the oldest nationally celebrated commemoration of the ending of slavery, the city of Peoria stands in solidarity with our African American community, and we encourage the public to attend one of the many celebrations on this day. Now, therefore, I, Rita Ali, Mayor of the City of Peoria, do hereby acknowledge and celebrate the 19th of June as Juneteenth. Our third and final proclamation recognizes the Peoria Symphony Orchestra 125th Gala. And we have our maestro, George Steluto, music director, and executive director of the symphony, Anthony Morato, with us. Thank you for being here, gentlemen. The proclamation reads, whereas for 125 years, the Peoria Symphony Orchestra, one of Peoria's oldest arts organizations, has endeavored to entertain, educate, and inspire through music. And whereas the Peoria Symphony Orchestra, heralded as one of the esteemed arts organizations in the region, is also a professional orchestra, employing hundreds of musicians each season. The symphony's work would not be possible without its volunteer board of directors, skillful staff, talented musicians, the Peoria Symphony Guild, and Peoria Symphony Foundation, along with the vision of Maestro George Steluto, who has held the position of music director and conductor since 2010. Whereas the Peoria Symphony Orchestra is a leader in presenting excellent live musical performances, providing accessible concerts like the Sound Bites and Musical Discovery television series, and introducing a variety of musical selections that captivate existing and potential patrons of the arts all across Central Illinois. Whereas the Peoria Symphony Orchestra will present its 125th season gala on Saturday, June 25th, 2022, at the Peoria Civic Center. The gala will celebrate the 125 years of excellence of the Peoria Symphony Orchestra and honor Sid and Flo Banwart for their years of dedication and support. Esteemed guest musician Ramsey Lewis, an American jazz pianist, will receive the inaugural Banwart Award for Cultural Leadership. Now, therefore, I, Rita Ali, Mayor of the City of Peoria, do hereby acknowledge the 125th anniversary of Peoria Symphony Orchestra.
Thank you very much. My name is Anthony Murata. I'm the new executive director of the Peoria Symphony and a brand new member of the Peoria community. So I'm really happy and honored to be here. Thank you, Mayor Ali, and thank you to the Peoria City Council. It's really an honor to be here, and I appreciate to accept this proclamation on behalf of the PSO for our 150th season gala. As the 14th oldest orchestra in the country, it was founded 125 years ago by Maestro Harold Plow, today, our current maestro, George Stoluto, is with me to accept the proclamation. It's an honor to work alongside George as we celebrate this momentous milestone and lead the PSO into the future. Many of you here are already attending our gala, which I thank you for that. If you want to come, which we would cordially invite you to do so, there are still tickets available, and we just need to know that by tomorrow. So we hope you attend. Let's see, what else? And so also our season tickets are currently for sale, and single tickets will also be available soon. But thank you very much for the honor. Happy to be here with all of you today. Thank you.
Thank you very much. Madam Clerk?
We are at the minutes.
Councilman Euler?
Thank you, Madam Chairwoman. I move to approve the minutes of the joint City Council and Town Board meeting held on May 24th, 2022, as printed.
Seconded by Councilman Ruckriegel. Any discussion? Please cast your ballots. Motion passes unanimously. Madam Clerk?
We have two presentations. 22-196 is a communication from Mayor Ali with a request to receive and file a presentation regarding cure violence.
Okay, thank you, Madam Clerk. This is in follow-up to our discussion at the last council meeting. We did not have enough information provided to the council for council to make a clear, I think, decision on cure violence study. So we brought back Ms. Monica Hendrickson, our county, I always mess up your title, so say it.
Administrator for Peoria City County Health Department.
Okay, thank you very much. And she has Katie with her, and she'll introduce her. We also have on the telephone Mr. Brent Decker. I think his title is the National Program Director of Cure Violence. So I want to say this, you know, our council is a caring council. Every member of our city council cares about our community, and the vote did not reflect uncaring about our community by anyone, by any measure. So I want to say that we didn't provide sufficient information. So we hope that tonight's presentation will provide more information and more opportunity for council to ask those questions. Okay? Take it away, Monica.
So good evening, Madam Mayor, City Council members, City Manager, and leadership. Again, I'm Monica Hendrickson. I'm the Public Health Administrator for Peoria City County Health Department. With me is my colleague, Katie Endres, who is the Director of Epidemiology and Clinical Services at the Health Department. And then on the phone, as Madam Mayor alluded to, is Mr. Brent Decker, the Chief Program Officer for Cure Violence Global. Thank you for inviting us to present on this evidence-based strategy. I'm not technologically this bad. Thank you. First, there needs to be an understanding that gun violence is a public health crisis. In Peoria County, homicide is the leading cause of death amongst our 15 to 24-year-old population, and the second leading cause of death amongst our 25 to 34-year-olds. In 2019, the Peoria County Board of Health, within their goal of health equity, identified gun violence as a strategic health issue. This is fundamentally a shift on how we look at gun violence as a community. Rather than continuing to look at violence as an issue only for law enforcement or criminal justice to find solutions, or thinking of this as a moral issue about bad people doing bad things, Cure Violence is an approach that takes it on as a health issue, based on risk factors, exposure, and transmission, so that we can actually work to stop the spread of violence. As public health professionals, we often utilize this public health prevention pyramid to address a health concern. We recognize there is a need for multiple interventions at various stages to effectively improve health. Within this pyramid, you have your primary prevention, which is creating the groundwork for environmental controls and addressing social determinants of health, so violence doesn't actually emerge. In this tier, basic needs are met, a community is thriving, and we work on general community interventions. This is currently happening in the city of Peoria in a variety of ways. You have economic and workforce development, community development programs, school readiness, and housing initiatives. All of these are considered that primary prevention approach. The next tier, or secondary prevention, is early response and intervention, where you look at data to determine what are the risk factors associated with violence. This does not mean that these individuals participate in gun violence, but rather they're the highest risk based on their exposure. So these are individuals that are living in poverty, have seen a history of domestic violence, communities of high incarceration rates, and gang activity. Much of the grants that you're seeing coming through the state through the Reimagine Public Safety Act actually fall through that secondary prevention level. The final tertiary tier is a long-term response, which is focused on the acute health event, specifically on the interruption of violence. The focus is to break the cycle of violence, and we call it a cycle of violence because sometimes the role of victim and assailant become very fluid and move back and forth, much like a disease or illness, and is considered a disease transmission. So here, the trauma of living in continuous violence creates an environment where people are more inclined to utilize violence. By using a public health comprehensive and holistic approach towards violence reduction, you need to have support at every single tier. Cure violence is a key intervention in that tertiary level. At that level, you have the highest acuity or severity of violence, but it's also where you need the most specialized care. The cure violence approach applies an evidence-based practice in which it looks to detect and interrupt, identify and change the thinking behaviors of the highest transmitters, and then work to change group norms. It is driven by local communities with the staff recruited from the neighborhood, and this is really key in terms of how effective this program is. It is a very much localized approach. While the community as a whole works with Cure Violence Global, the staff, specifically the violence interrupters and the outreach workers, are recruited from the neighborhoods where they serve. So Cure Violence is based on a theory of change model, and there's 3 different avenues that focus on. The first is to detect and interrupt. Trained violence interrupters and outreach workers, again, who are hired locally, work to identify and mediate conflicts. They are separate from law enforcement and are considered highly credible amongst those high-risk transmitters. They prevent retaliation, mediate ongoing conflict, and keep conflicts cool, all with the premise of stopping a violent event before it happens. The next avenue that Cure Violence focuses on is identify and treat. Trained outreach workers use culturally appropriate and trauma-informed services to reduce risk. They communicate with those high-risk individuals and help them attain social services. They use their own trust capital to work and establish relationships in the neighborhood. Then they start communicating on how you can change your behaviors, talking about what the costs and consequences of violence are. And then lastly, they do intensive case management, all this to reduce the number of violent individuals. And then lastly, it is a focus on changing norms, where workers engage with the community to message that the residents and various groups are not supporting violence. They respond in their catchment areas to every shooting to have that singular voice, as well as to organize communities that either have existing or new programs to help prevent violence, and then lastly, to spread positive norms. So distribute events, distribute materials, host events to make sure a community recognizes that violence is not acceptable in that area. All of this creates that social pressure to stop violence. And these 3 streams lead to a reduction in violence. This is a fundamental shift towards thinking of this as a public health issue. This isn't about bad people committing senseless acts to be punished, but rather these are individuals that have had learned behavior, that it is a contagious process, and we don't need to punish them, but rather to work towards interrupting and changing their behaviors. If, as public health and healthcare professionals, we use that old view or old language or vocabulary to talk of people that are obese or that smoke, we would be considered insensitive and inappropriate in terms of how we provide care. So let's not use that when we talk about violence reduction. I will now turn it over to Katie Endres, our Director of Epi and Clinical Services, to review the evidence about this approach.
So Cure Violence has reduced shootings and killings between 30 and 70% in some of the hardest hit communities in the United States and Latin America. Initially implemented in Chicago under the name Ceasefire, Cure Violence yielded between 41 and 73% reductions in shootings in 5 of the 7 target neighborhoods. These findings were all attributable to the program, as changes in comparison neighborhoods for the same outcome measures were insignificant. Additionally, retaliation killings stopped completely. When Baltimore replicated the Ceasefire program under the name Safe Streets, large statistically significant reductions in homicides and non-fatal shootings were observed in 3 of the 4 target neighborhoods. Across all program sites in Baltimore, the intervention was responsible for 5.4 fewer homicides and 34.6 fewer non-fatal shootings. Further analysis of the Baltimore program revealed that participants benefit from connections made with outreach workers, with 80% of program participants reporting that their lives were better since joining Safe Streets, and 276 conflicts were mediated, preventing increased tension and further violence. A neighborhood known as Crown Heights in central Brooklyn replicated Ceasefire under the name Save Our Streets in 2010. Results showed a decrease of 6% in average monthly shooting rates. While this was not statistically significant on its own, when compared to 3 similar adjacent neighborhoods, it revealed rates increased between 18 and 28% in these areas during the same time period. This analysis made the decrease in Crown Heights significant and suggests that gun violence was actually 20% lower than what it would have been had trends been similar to those of the comparison neighborhoods. This program also measured police-community relations, showing positive changes in police trust and willingness to call the police. North Philadelphia then replicated the Ceasefire model in 2012. Each of the 3 target areas where the program was implemented experienced significant shooting reductions of 2.4 per month. So Benjamin Franklin coined the phrase, "An ounce of prevention is worth a pound of cure." And while a program such as Cure Violence will effectively be saving lives, it needs to be done with fidelity, true to its intent. And that's why it's important to consider the costs and the return on investment. An independent analysis done on the Cure Violence program over 10 years demonstrated that for every dollar spent, the program saved 33, and for every dollar invested by government, $4 were saved. It could also be argued that tax dollars from every homicide prevented could be allocated to sustain the program, as a report published by the National Institute of Criminal Justice Reform calculated that each homicide in Stockton, California, cost taxpayers approximately $2.5 million between crime scene response, hospitals and rehabilitation, and criminal justice expenses. So if Brent's available, we'll now turn it over to him to discuss the next steps and answer any questions that you may have. Thank you.
Great, thank you. And I apologize to everyone in the room that I couldn't be there with you all in person. My name is Brent Decker, and I'm the Chief Program Officer. And essentially thank you for giving a good layout of the program. When we typically get contacted by a jurisdiction, by a city or a county, the first phase of work is really this kind of assets-based assessment work, where we really try and work with the city, with the county health department, with local community-based organizations, with law enforcement, to do a couple of things. One is to figure out, hold on one second.
Can you hear him?
First is trying to figure out where are like the areas that have the highest concentration of violence that we can
Mr. Decker?
Program.
Yes,
can you hear me?
Mr. Decker, can you speak up just a little bit?
Let me take these headphones off and maybe it will work better. Hold on one second. Is this better, Mayor?
Yes.
Okay, great. The second part is once we kind of determine where the areas of violence is most acute, is then work to see like who is most likely to be involved, both as a victim or as a perpetrator, right? As someone who's been exposed or someone who's potentially to transmit more violence. Once we have that figured out, and I think largely we do in Peoria, the idea becomes like, how do we find the local community-based organizations that are best suited to implement this type of program? Then how do we find kind of a recruitment strategy to find folks that can serve as interrupters and outreach workers? And then we make some program recommendations for the jurisdiction to kind of decide, like, does this make sense as part of the comprehensive plan or not? And so that's kind of what the objective of the asset-based assessment visit is. It's not necessarily a study per se, but it's really about trying to understand the local context so we can best adapt and then position the intervention to be helpful to the city's broader strategy for violence prevention. And so that's kind of the first phase of work. And the way that this usually goes is there's usually a number of kind of 101 presentations about the model to various stakeholders. Then we kind of move into having more one-on-one conversations with like community groups, folks around data, with the health department to really understand some of the dynamics. Then we come visit and spend some time in Peoria, particularly in the areas that have the most acute violence, to meet with potential community groups, to meet with potential workers, to really kind of understand what kind of staffing patterns are going to make sense given the local context and dynamics around the violence. And then, like I said, we come back with a report that kind of lays out the best thinking of how this can be added to what the city of Peoria is already doing. So that's kind of what the assessment work is really about. It's really about, and we're, based our founder was kind of from the World Health Organization. And so we're really kind of about like action research, if you will. It's like really trying to figure it out and start implementation as soon as possible because, as we all know, sadly, lives are being lost every day. So that's kind of what the assessment work would look like. I would be happy to take questions or concerns about the model, the idea behind it, some of the research, or anything involved in the assessment process.
Mr. Decker, just for starters, this is Rita Ali. I know that there was some questions when there was a presentation earlier about whether Cure Violence replaces or duplicates existing strategies, initiatives, or programs. Can you speak to that?
Yeah, sure. So our objective and goal is never to come in and replace or displace anyone or any other type of intervention. I mean, I think as was discussed in the presentation, there are a lot of levels in which communities and folks need support around health and health indicators and violence being one of them. And so we have a very specific lane. Our work is really designed with those that are at highest risk to be involved in violence and work with them, right? That's kind of our goal. And so what tends to happen is if there are groups or organizations that are doing something similar, oftentimes they are kind of tapped to be the implementer, right? The thing that we're able to do is, given our kind of 25 years or so of experience, is help build the local capacity. So if there's many of our best partners have done something similar. They might have done after-school programs, reentry programs, some street outreach, but what we're able to provide is ongoing training and technical assistance to really build up that capacity to be able to operate kind of more from an epidemic control kind of protocol standpoint that can be added to the organization's already existing skill set. And the other thing I would say is oftentimes this is a gap in terms of this work with the highest risk, late at night, up into early in the morning, working non-traditional hours, working in the target areas, often not there are office space, but it's really the work is on the street with those that are involved in the highest risk. And so hopefully this can be additive. It can be complementary to what's already going on in Peoria as another way that we can work together to reduce violence.
And you also spoke to this not just being a national initiative, but it's being implemented in various countries across the world?
Yes. So we almost as soon as we started doing our program across the U.S., we started doing programs across the globe. And our first replication program was actually in southern Iraq, in Basra. And so I spent a bunch of time there. And what we did is we adopted the same three things that were discussed in the presentation, but we worked with the tribal leadership as well as the militias associated with political parties to try and prevent violent events in Basra and then later outside of Baghdad in Sadr City. And again, what it uses, though, I think what's very powerful about public health is it's very community-centered and it supports local actors that have the type of relationships that can really get in before things happen and prevent something before it happens. Once a violent event occurs, right, of course, that's the role of law enforcement and other infrastructures, but then we also can be helpful in terms of calming down family members, friends, so that there's no further retaliation. So the first program internationally was in Iraq, and then we expanded in Honduras, Mexico. We're working in Argentina, Trinidad and Tobago, Colombia. There's been 3 evaluations done of the work, one in Mexico, one in Cali, Colombia, and one in Trinidad and Tobago. Again, showing very similar results that we've seen in the U.S. in terms of the ability to reduce violent incidents at a community level, usually within the first year and maintained as the program goes on. And so I think what we try and do is always take best practices. I mean, we had a project in South Africa for a while. And, so we kind of take the best practices as well as the most recent kind of scientific literature around this to help inform kind of the training and the technical assistance.
And how long have you been working with the program?
20 years.
10? You say 10?
20.
20. Okay, you've been working with the program
20.
for 20 years. I think Officer Hodges is here somewhere too, and I know he has some
Yes,
experience working with the program.
I know Officer Hodges from when he was Pastor Hodges a long time ago.
Right, okay. And then, Katie, you've been studying the program for a number of years. 3 years, okay. So we've got resources here today. Our public health administrator, these various resources. Let's please ask them some questions. Councilwoman Jackson?
Thank you, Madam Mayor. Mr. Decker, I don't know if your research shows any of what I would like to find out more about, but we are trying to promote economic redevelopment here in Peoria, attract new businesses to our city. Does any of your research point to correlations in crime versus economic redevelopment? Are businesses less likely to be interested in coming to communities when there's peaks in violence and crime of that nature?
Yeah, so the evaluation work we talked about was kind of independent evaluations that were done by either Department of Justice through universities to kind of independently verify, what we were talking about. So unfortunately, I don't think any of those research really looked at economic redevelopment. But what I can tell you is in many of the areas that we work in, I think about Monument Street in Baltimore, I think about a lot of the neighborhoods that we work in New York, have seen, as the violence gone down, businesses being more able, willing, and interested and feeling safe to kind of open up shop there. And I think if you look at Paul Collier's work about the bottom billion, one of the main kind of 5 things that prevents economic development is violence. And so that's one of the issues that I think could be helpful.
Thank you.
Councilmember Kelly?
Thank you, Madam Mayor. Mr. Decker or our speakers, I have a couple questions. On the last slide, you talked about hiring and interviewing. Who is it that does the hiring? First of all, who is it that does the hiring of these folks?
So I can take that, and if Mr. Decker wants to also chime in. So in regards to who actually hires these individuals, it would really depend on what we gather from the assessment, because as Mr. Decker spoke, the assessment very much looks at the capacity of a community to understand what are those key community agencies and partners to help establish kind of the structure for how Cure Violence would be implemented. And there are various models, and every city does it distinctly differently, but then based on whether it is run through a municipal government, such as a city office, sometimes it's done through a non-for-profit or even a public health, that would be the entity then that would contract out to those services. And again, the individuals that would be hired, because we want them to be credible and need to be credible amongst those high-risk transmitters, they're going to be individuals that live in that neighborhood and have experienced violence in their lifetime.
Thank you. And then to the second point of that bullet point, interviewing. Is the police department involved in the interviewing of these folks? Typically, or?
Again, I think maybe Mr. Decker can answer this clearly. My understanding, it is a collaborative approach where you have...
Yeah, so...
Yeah, thank you, Brent.
I'd be happy to answer that. Yeah, so the way that our hiring process kind of goes through three phases. One is kind of a pre-screening where whatever the agencies which selected to do the work, really spend some time, because we want folks who are credible, but they're also suitable, meaning can be part of a team, have other kind of positive support things going on in their life. So we kind of do a little pre-interview work before we actually bring someone to a panel interview. And the panel interview consists of community-based organizations, faith leaders, oftentimes law enforcement. We would participate, and whoever the selected agency is, to have kind of a pretty comprehensive interview with the potential workers to see who both has the credibility and suitability to do this work. And so that's where the collaboration between city agencies is super important in terms of kind of participating in this. So it's kind of like a group decision, as this is sometimes new work in a jurisdiction.
Okay, and then the next point on that slide was training. I understand there has to be some significant training of these folks, these interrupters, et cetera. Who does the training?
Yeah. So we if the city decides to go forward with it, we provide kind of a comprehensive training we work with a health department that might be newly doing this work. We work with the community, provide training for the community-based organization in terms of like general implementation. And these are 2 to 3 day kind of training workshops. Then once the workers are hired, there's a week-long manager training, there's a week-long violence interrupter and outreach worker training, and there's a 3 to 5 day kind of database training. We have a web-based database that helps kind of capture our work in terms of kind of mediations and working with participants with the highest risk. And then we provide quarterly booster trainings kind of based on how the sites are doing, how the site's doing. And then we do weekly, for the first year, we do weekly phone calls with the site to kind of just provide that additional support. And then if there's ever a need to come do an additional visit, we kind of have that planned out as well. And I think, half of our staff is based in Chicago, so Peoria is not too far, so it seems like it would be pretty easy to spend a significant amount of time there. But the goal in all these trainings is to share what we know and what we've kind of learned in the past 25 years to build the local capacity to do this. It's really sharing best practices, helping think through difficult, either mediations or situations. And so it's again, modeled off the World Health Organization, where we, would work with ministries of health. It's really kind of an all-in partnership for the first couple of years.
Can you give us an idea of the number of these trainers, the number of the ongoing people who check in, monitors, et cetera? How many folks are these? And I suppose these are your folks. Is that right?
Yeah, right. And so So to be clear, and sorry if this is confusing. So the staff locally would, be the 5 to 10 staff who are doing the implementation. I'm not exactly sure what it would be in one of the communities, for example, who I think would be overseen by the mayor's office or through the health department. Then our role, we have a staff of about 25 staff, but we would have 1 or 2 that are specifically assigned to Peoria for the ongoing kind of weekly calls. In terms of the training, it just kind of depends on some of our scheduling, but we, when we're working with the jurisdiction, we prioritize, ensuring that everyone gets the trainings that they need. So I hope that cleared up the question.
Thank you very much. Thank you, Madam Mayor.
Very welcome. Councilmember Euler?
Thank you, Madam Chairwoman. Several questions here, so probably answers from different directions. First one is the health department has obviously had some involvement in getting to this point. What level of funding is the health department putting into this?
So our Board of Health, because this is a strategic issue, has been very open about supporting this type of intervention. We do it for a lot of our community-based interventions throughout the time, but so we don't necessarily have a specific line item for cure violence alone, but it is within our entire strategic plan of the Board of Health.
So you're willing to pay the $25,000 for the assessment?
We are willing to do what it takes to help bring interventions into our community to reduce violence.
Okay. We're being asked to re-vote on this again tonight, is that correct? And we just got this presentation just now, is that correct? So we're being expected to vote on something that we've had for 5 minutes, so that sounds about like Springfield politics to me. Are we going to get a presentation on the other programs that were presented to this SNET group as we requested in the last meeting?
If I could go ahead and answer that, Councilman, as far as the other community-based violence reduction initiatives that we may be looking at, the plan that we would be looking at doing would be to issue a request for proposals, so that we would have that request for proposals go out for those types of community-based violence reduction initiatives, and then have those solicitations come back, so then we could vet those and have those then presented to council for approval.
I want to add to that, Councilman Euler. There were several presentations where agencies or organizations actually apply for money through the state, through R3 funding, through Reimagining Public Safety funding. Several of those organizations were funded for the programs that they had recommended. This initiative was probably the most recommended, without a doubt. There were 2 different proposals, one that was presented by the health department, one that was presented by Officer Hodges, and it is one that is recommended by the Department of Justice as a evidence-based strategy that works. So this was why this was recommended, because it's been proven as an evidence-based program throughout the nation, throughout other countries, that works, and so it's more comprehensive than some of the other programs.
Thank you. I appreciate that, but in my opinion, we're still in the exact same place that we were, that we have another group that is not a decision-making body evaluating what's in our best interest, and I'm being asked to spend taxpayer dollars on something that I don't have the fair opportunity to vet out. Thank you.
It's really a community group, a community engagement process that has taken place. It's actually engaging the community in being involved in gun violence reduction. Police will tell you they can't do it alone. We need the community's help, and these are people that have stepped up to really help be part of the process. So, other questions? Councilmember Graham?
Thank you, Mayor. Mr. Decker, can you hear me all right?
Yes, I can.
The name of the program that we're looking at is with the acronym CVG. I kind of like those initials, but I don't think it's named after me. Mr. Decker, I've done a lot of research on this because everybody in the room here and in our community wants to see a reduction in violence. Why has this program been renamed? I believe it was Ceasefire, is that correct?
It was, yes. So the reason we renamed it maybe 10, 12 years ago. I don't even remember when it was. We didn't own the name Ceasefire, and it got often confused with the Boston model, which was called Ceasefire, which had kind of a different approach than ours. And so we kind of worked with community partners and different agencies to kind of rename it to be more kind of squarely reflect our kind of public health approach.
Well, you know, I didn't know if there was a strategic reason why Ceasefire was no longer used as an appellation for this type of programming. I will tell you that when I read this, like Cure Violence Global, I imagine we're sending out doctors and nurses and people who have vaccines and maybe shots. And it just seems like it's just a little bit of a stretch to try to portray this as being similar to coronavirus or some other communicable disease. I get it that there are certain sections of the city that are rife with violence. We know, we call them hotspots. There are, I'm sure, other names that can be used. But there are certain operational issues that I think the council must grapple with. I think it's too cute by far to be using this medical analogy. That kind of turns me off right away because it's nothing to do with that. Unless you want to say somebody being shot, that's a community health problem. It's a problem for the person being shot going to the hospital or somebody being killed. That's a problem. But I just don't know what happened to Ceasefire because I think that comes closer, and I wouldn't discredit that idea, to what we're trying to do. We're trying to cut back on what appears to be an epidemic of gun violence, not only in this city but in elsewhere, in other cities as well. Under whose jurisdiction, and I think this was touched on earlier, would the hiring occur? I guess I'm hearing that's TBD, to be determined. And Dr. Decker, I don't want to put you on the spot. We'll let whoever can answer this question answer it. You know, it's kind of amorphous when it says, well, it could be, you know, a bunch of community-based organizations that determine who is hired to do this. Are they in any way, shape, or form screened by the police department? Is this run by the police department? These are important and critical questions that I think need to be made. A couple of my fellow counselors said last time that the people who would be involved in the Ceasefire or CVG program would be doing the dirty work that we don't want to do in this chamber. And when that is said, it makes me think like there's something wrong. We have some kind of illegitimate clandestine operation that can't withstand the light of day. So just the way the conversation's been going, I think we need to refocus and reframe in order to get community support for this. I think the other issue that for me is important, and I think this cuts to our Peoria Police Department as well, because they're our number one provider of anti-violence initiatives. And I think they should be the number one provider of anti-violence initiatives, is do we think in some way that there's a contamination of the process if the police department are guiding this, if it's under their aegis, if it's under their supervision? How How are the people screened to be sure we don't have somebody out there who is really not been transformed, but going into certain neighborhoods in our city? So these are some of the things that come to my mind. I don't care who answers some of these or in what order, but I think this is where I want to start.
Okay. Who wants to start?
I guess I will start. I will first just recognize the fact that violence is a community health issue. It is, I think, one of our top health issues in our community. And the term cure violence is not to necessarily think of it as a medical approach. You know, you referenced COVID and vaccinations, but the core of public health is you identify a health issue. You identify the risk of who is exposed and the population that is exposed, and then you look at the transmission of a disease. And you create barriers. Some of them are non-pharmaceutical. If you remember, before we had a vaccine, we talked about social distancing. We talked about face coverings and capacity limitations. And then when you do have different interventions, as time goes on, you implement them. And so, first and foremost, you know, I respect your discussion about needing to have more tiers, and I definitely applaud our police chief and the work of his staff. They have done a great job in looking at violence, and that's why they have been partners in this discussion with us around cure violence, because if you're having a comprehensive and holistic approach to health issue, you have to have multiple levels. There is no, you know, magic pill, and there's no singular option. But it's a complex problem, and you have to take on the complexity of it by approaching it in different avenues. And so this is not meant to replace or the be-all everything, but rather to be a part of a larger, comprehensive approach that the city has already taken based on the work of your police chief, city council members, what you've put towards your budget in terms of economic development and building readiness in our community. And so this is, again, just one piece of a larger picture. And we call it cure violence because it follows the core public health values of how we actually address the health issue.
And, I mean, it has been called different things. Like, each community can decide what they want it to be called, correct?
And I think if Mr. Decker can talk more to it, but every community does brand it differently because, again, part of it is that assessment is understanding the context of the community's needs.
Mr. Decker?
Yeah, and the only thing I would just add in terms of the screening process, and I said it before, and I'm sorry if it wasn't clear, but there's a hiring panel process that takes place that involves the faith community, different, you know, sector, maybe from the mayor's office, including law enforcement for the applicants to make sure that the workers are both credible and suitable to do the work. And the other thing I would just add, I mean, I think, you know, when we think about public health and violence, I mean, the institutions that kind of, I guess, define what public health is, like the CDC, like American Public Health Association, like the World Health Organization, like Institute of Medicine. I mean, all of these institutions have understood violence as a contagious process, as an epidemic, and as a public health issue. And so I think, you know, I'm sorry I don't have enough time or the presentation slide to go through it, but it actually meets the medical dictionary definition of contagion. It causes more of itself by how it spreads. And so I would be happy at a later date if we work on this assessment to kind of go more depth into the kind of current understanding about the contagious nature of violence and and why it's a public health issue.
You get most of them.
So one last thing. I like to be really, really specific. What would this involve? Somebody who's been in the correction system being assigned by somebody to go to a highly violent hotspot area of the city? Would it be a pastor? Would it be an imam? Would it be a mother? Who are these people?
Yeah, they're all the things you just mentioned. You know, I think in every community the staff makeup is different, and that's where the assessment process kind of comes in. So we'd think, okay, where are the neighborhoods where violence is most acute, and who's involved in the violence? Who has credibility to work with them? Sometimes it's a football coach. Sometimes the pastor. Sometimes it's someone that had a similar life experience. but it really depends on the where, the community group, and some of the dynamics. I mean, for us, the profile that's necessary is credibility with those who are most likely at highest risk to be involved in violence. And so sometimes it is a pastor, sometimes it's an imam, sometimes, it just kind of depends. A lot of the workers, yes, some of them have been formerly incarcerated, some of them were involved in some of these issues before, but that's not exclusively who the staff is. Many of them are fathers and mothers as well, uncles, brothers, and so I think it really depends on where the work, the assessment is of how this can be helpful. I think if you think about Officer Hodges' experience in Decatur, the staff that they had was different, it was diverse. I think, but the thing that we really try and work with the jurisdiction about is like, what is the recruitment strategy that's going to make the most sense so that this can be helpful to the overall health and of the neighborhood.
And now these folks are going to be paid, is that correct?
Yes.
And do we have some knowledge as to how that's going to be done, how they're going to be paid? In other words, they're not doing this out of the goodness of their heart.
They're employees.
They're employees of whom?
Typically of that community-based organization.
Community-based organization, okay. And that community-based organization might be the health department?
No.
Urban League?
A community-based organization.
Community-based. Could it be a community-based organization that doesn't exist now?
I don't think so. They wouldn't have any credibility.
Because
I've
heard from a lot of people who think we have a lot of capacity right now, and they would like to be involved in this. Also, what's important to me, and I've seen this for too many years, we adopt a program, have the police department involved, and the rank and file police officers know what's going on. Do they buy into it? Do they endorse it? Do they think it's helpful? There are just so many questions, and so, Mayor, I don't think it was because anybody wanted to say no to a potentially good program. Violence is tearing this community apart.
Yes, sir.
So we want to come up with something that makes sense for our taxpayers and will be efficacious. We had for a number of years, and then I'll stop, we had something called Don't Shoot. And I think, some of you weren't, well, maybe most of you were here when we had Don't Shoot. We don't use that term anymore, Mr. Decker. Is that a discredited philosophy, the Don't Shoot program? Discredited with the CVG people?
I think there are still public education materials that are used across the country say don't shoot, I want to grow up, based on some of that initial public education that was designed. In terms of a don't shoot program, I'm not familiar with that.
Can you compare and contrast your CVG to Don't Shoot, which we had in Peoria for at least 18, 19 years?
I could not know.
Total different strategy. Totally different.
Okay, thank you.
Thank you, Councilman. Got a lot of comments or questions coming. Councilmember Rodrigo.
Thank you, Mayor. I guess a couple of questions, and I would address them to Executive Director Hendrickson, I guess, first, and then if they need to go somewhere else, they could. Circling back to the public health sort of analogy there, can you, I guess, give us a little clearer example, I guess, of the public health, how that works in that sense? Somebody who's growing up in an environment and what, I think you and I have talked previous in the past about like the lead paint example, and how that becomes a public health situation as somebody grows up. Can you just kind of address how you see this as a public health crisis and how one sort of environment piece leads to an outcome?
I also turn it over to our director, Katie Endress, who, for those of you who are not aware, is working on her violence reduction fellowship right now, and so it has been researching this for some time. But overall, when we're talking about any disease or health issue, whether it's lead paint or whether it is a sexually transmitted infection or influenza, there is a level of how we kind of do public health. First and foremost, we identify risks. We identify what the environment is creating that brings forward additional stressors to that individual to make their likelihood of exposure or their likelihood to maintain that behavior repeated. For a great example, and I think that we're all very familiar with, is tobacco use. Statistically, individuals that grew up in a household with tobacco use tobacco. And again, that is a behavior that's a learned behavior. Similarly, the diets that we eat, our exercise are all learned behaviors. So the environment that you are raised in, both physically and the community around you, really dictates a lot of your health issues. And then from there, based on those risk factors and identification, you start looking at where do we start putting our intervention points. And there, again, is going to be multiple intervention points, whether it is an educational campaign, so again, the changing of the norms, whether it's identifying what services an individual needs. It might be housing, it might be access to healthy eating and active living lifestyle, or access to a primary care provider. All of those things play a role. I always use the example of the Robert Wood Johnson Foundation and the University of Wisconsin have a health model they use to actually talk about the outcome of someone's health, which is the length of life and their quality of life. And that's your end health status. But that health outcome is based on a multitude of health factors, which can be broken into 4 buckets. One is your healthy behavior, one is your social economics, the next is access to care, and the last is your environment. What's interesting is that those are not equally weighted. In fact, your social and economics, as well as your health behaviors, account for 70% of your future outcomes. And you think about it in terms of lead paint, which is a great example. You have an individual or a family that has a child that is exposed to lead paint, has high lead levels in their blood, and which creates neurological and developmental issues as they grow up. But if they go see a provider and they're taken care of at that provider's office, which is great, they still go back into that environment and they get re-exposed to the lead, and then they have to go back to their provider. So again, it's really addressing the different intervention points. One at the acute level, where it's the medical provider, but also at that environmental level with that prevention or tier 1 strategy of looking at the household and mitigating that. So when we talk about public health, it's never about a singular intervention. I wish it was. That would make our lives a lot easier. But it's about that multitude and the complexity so that we are able to address things. The point of cure violence, this is not meant, again, to replace, but to look at that individual with our most acute care. And when we're talking about the hiring and the individuals that need to communicate with them, if I'm at my most acute health issue, say cardiovascular disease or what have you, I go to a specialist. I go to an individual that is trained and aware of that situation. And that's why the training of that staff and the hiring is so important, because you want individuals that are credible, that their message and their communication, so someone that's in that acute status of health need will understand it and be receptive to it.
When I look at kind of the presentation today, and we talked last week, something that I guess, and I'm not hearing it though here, and maybe it's just something I'm missing, or maybe that there's a thought process, isn't it? Is this a collective impact model, and is that where the assessment piece is bringing to light those pieces? And one of the misconceptions I had at one point was just city resources, but it's whatever resources are within the community, correct? Is this a collective impact model?
Parts of it are a part of the collective impact model because, again, for any program to be effective in a community, you have to have those various lenses. There's a reason why your physicians in the ER and your trauma surgeons, endorse this type of program, because to them, when they see those individuals come through their doors, that's a health issue. You're looking at how the hospitals, how the schools, how religious organizations, law enforcement are all supportive of a program. And so, again, part of the assessment is understanding the context of your community. Not only our ability to have the resources, but also do we have the personality and readiness to take on this project. And that's where as Mr. Decker mentioned, you're going to have a lot of town halls and one-on-one meetings with different stakeholders because they're all going to see this health issue in a different lens, and that way they can be supportive so that collective model exists. So that's part of the assessment to gauge the readiness of our community, and then also understand, what are those contexts that is driving the violence in these different segments of our population, and then working to get those key credible individuals to be placed in there so that we can have the right voice in the right area.
And my last question, I guess this is maybe for the mayor, might be for Executive Director Hendrickson, might be with our speaker. There is the thing that I think I heard you say is, so far, we don't know where this will be housed yet. That'll be part of the assessment. Is that correct?
Part of the assessment, yes.
Okay. And then I know you said we have some more questions here, and then I think after we're done, I've had a citizen who's asked for a question later on if they can ask about sort of the role of local versus nationwide staff and how that all.
Sure.
Okay, thank you.
Okay, welcome. Councilmember Jensen?
Thank you, Madam Mayor. One of the main questions I have, since we are only being asked tonight, is to approve the $25,000 for the assessment. So can you tell us what the assessment will entail? Like how long it will last? What will be done during that assessment? How do you do it?
Mr. Decker, I think, did you hear the question?
I did, yes. Can you hear me okay? So the assessment takes, either, it really depends. Here are the kind of the phases of it that I described before. I guess before I do that, we're really trying to answer 5.
Can you move closer to the microphone or
speak
speak up? We're having a hard time hearing you.
Yeah, I unfortunately I have to be in a car right now, and so I'm doing my best to speak into the phone as much as I possibly can. If you can't hear me, I can potentially write in the answers at a different time. I apologize. It's just the reality of having a 6-year-old. I have to drive you somewhere right now, so I apologize. So can you hear me now or no?
Not very well.
Brent, maybe I can answer this for you. The assessment varies just based on, first and foremost, the data that's already available in a community. So they already do some pre-assessment work by collecting data from the police department as well as the health department. And then on top of that, then they start doing these interviews or these one-on-one sessions with key stakeholders to start gathering that portion as well. So it really depends on, again, what can be provided, a community's responsiveness to providing them information. But it can go anywhere from about 3 to 6 weeks depending on just the readiness of a community.
Okay, and who are the key stakeholders? Can you give examples?
Various groups include, for example, elected officials, of course, hospital systems, individuals in those hot zone neighborhoods, and I believe they actually meet with them independently, recognizing that they may have different needs and driving forces. Community agencies that provide social services, whether it's housing, food safety, school districts. So they group them based on the lens they see this health issue within.
Okay, and then as a follow-up, I guess all we're asking to do is to do the assessment. That does not mean that we're going to hire this group moving forward. I mean, there's a good chance we will, but that's not what we're being asked tonight. We're just trying to get an assessment of what the issues are and what possible solutions are. Is that correct?
But what's being considered is the assessment, not the implementation of program.
So I guess as a follow-up question, and maybe this goes to the gentleman up who we're having a hard time hearing, but do you sometimes do assessments and then are other organizations then, if we open it up to an RFP that was discussed with the city manager and answering, I think, Councilman Euler's questions? I mean, that's a possibility down the road. Once we get the assessment, we could do an RFP and see what other proposals are out there.
Well, you could do an RFP for cure violence to determine what community organizations might be an appropriate fit. And you can also do the RFP that we talked about for the ARPA funding, which we plan to do that anyway. So it could be both, because there is $500,000 from the state that's been allocated for Cure Violence for Peoria. That is already in place.
Okay, but we, as a council, put aside a certain portion of the Recovery Act money that we were receiving, and we decided to put that aside for violence prevention programs.
That's correct.
So we can use that money after we get the assessment if we decide as a council to do an RFP to see what other proposals are out there once we get the assessment, if that's something we want to do.
That's entirely a policy decision for this council to make.
Okay, so we're just being asked to do the assessment
Right.
tonight. Okay. Thank you very much.
You're welcome. Councilmember Allen?
Thank you, Madam Mayor. One of my questions was answered via Councilmember Jensen regarding the timeline of the assessment, so I appreciate you asking that. Mr. Decker, Peoria has a population of about 111,000 people and some change. In the summary of independent evaluations, it lists a lot of major cities. Are there any comparison cities that this assessment has been conducted in that is comparable to the population of Peoria, just for a reference point?
Yeah, so I think our point of analysis and implementation is always at a community level. So when we say Baltimore, we're not talking about a citywide program there. We're talking about 3 specific communities. And so I think those largely have similar, maybe a little less population density, but we're working in a lot of cities in North Carolina that I think have similar populations and specifically at the community level, similar population densities that we would likely see in Peoria. So our unit of analysis is really kind of a community and not so much like a city level program, if that makes any sense.
Yes, it does. Thank you.
Councilmember Velpula?
Thank you, Madam Mayor. Thank you, Monica, for that wonderful presentation. I actually got stuck at the first slide itself, where you showed a pyramid, right? First, I need a clarification question, and then I'll follow up with another question. Could you tell me what is the percentage of the tertiary prevention, or if you have numbers, like what percentage do they contribute to that pyramid?
Great question regarding, is there a percentage of intervention points? It's not meant to be a percentage of intervention, but the scope of intervention. So something at the primary prevention is on a community-wide level. So something such as workforce development, economic development, school readiness, that is a broad span of intervention. The secondary pyramid, or second tier, is not meant to be slightly less, but more focused. So you're looking at, based on risk factors, a targeted population that's at higher risk based on exposure. So those that might be living in poverty, domestic violence, incarceration rates. That last tier, though, is your most focused population, and those that are currently living in an acute health crisis, which is gun violence.
So as most of the discussion that we had now had an analogy drawn from a disease standpoint, right? All my education, I was learning that prevention is better than cure, right? So as much as I appreciate the Cure Violence initiative, I still can't, put my brain behind it. Why, for the program, I know it's still an assessment, but let's say the primary thing is to go back to schools, and I don't know whether we have an assessment for that. And the secondary thing, as you rightly mentioned, the risk factors, which compose of poverty, domestic violence, gangs, public safety. And so we are actually addressing it at the terminal stage for me. I mean, I may be wrong, though, but I don't know whether, maybe this is a question for city manager as well. Maybe, is it an advisable route to go as a multi-pronged approach, since we are already doing it? I don't know. Are there initiatives to start from the primary prevention, then, follow through? It's just my suggestion, though. Anyway.
So Councilman, we are. If you look at how we've allocated our American Rescue Plan funding, we are addressing it that way. Our primary prevention activities, those approaches that occur prior to violence occurring, is some of the work that we're doing within our neighborhoods. We put $2.5 million of our American Rescue Plan funding towards addressing our neighborhoods. Some of the work that we're doing from an early intervention and response, we're putting money from the American Rescue Plan into economic development and workforce development. That's specifically addressing that in those areas that we're trying to focus on as well. And then lastly, this, which we have the smallest portion of the American Rescue Plan funding that we're setting aside, is for violence prevention. And this is just $25,000 of that $1.3 million to do this assessment to see if this model could work in Peoria. So it's already in place. You're already doing that. We're already focused. There's additional funds that the health department has been focused. The council made that adoption of the Public Health Equity Fund that we'll be working with the health department on to focus on the social determinants of health that our public health administrator, Ms. Hendrickson, just mentioned, and talking about the social factors that are affecting us. So we are doing that with this effort in order to try and change the outcomes in our community.
Thank you, Mr. Manager, but I'm not questioning the item on the agenda today. So the cure violence is an assessment. I understand that, but the idea that you presented to me, that money is already in the community. I think the allocation is already made. So that means the multi-pronged approach is already there. So that means we are hopeful to see the prevention happening at the school level, at the community level, as well as now after the assessment, we'll see something at the terminal level.
That's correct. I mean, I think in every one of the public bodies that has received funding at the federal level, the school district has received, I think Peoria Public Schools has received almost $105 million of ESSER funding, which is elementary and secondary education funding through the Department of Education that came through the American Rescue Plan. And that's the monies that they have been using to try and address the situation that we found ourselves in post-COVID and during COVID, and the efforts that they're continuing to do to try and improve education outcomes in our community. We're continuing with the American Rescue Plan dollars to try and focus our efforts on the built environment, on our small businesses that have been impacted by COVID, and now to try and focus on improving health outcomes and addressing violence in our community. So I think it's a multifaceted, multi-jurisdictional approach that we're taking with this.
Thank you, Mr. Manager. Thank you, Madam Mayor.
Thank you. And Councilman Velpula, I would just add to that, we're seeing more funding coming in for programs throughout our community, after-school programming, in-school programming, kind of community-based youth development type of program. All of those seem to be falling at the primary and secondary prevention levels.
Madam Mayor, thank you for the answer, but it would be very interesting to see whether these dollars really made the difference, or are we just, as a council, we spend money, but are we really following up on whether that money that you spent is really giving the yield that we are seeking for? That's exactly what I was trying to go after. Thank you so much.
I agree, and I think a lot of times we're responding to the symptoms, but not addressing the root cause.
Thank you, Madam Mayor.
You're welcome.
Thank you, Monica.
Councilmember Jackson.
Thank you, Madam Mayor. I just want to kind of piggyback. Quite a few years ago, I was working as a matter of fact, I got the opportunity to go to Rockford, and with a photographer, we walked the streets with ceasefire. That happened during a time when the city was looking, I think that was even before the Don't Shoot, but if I remember, the city implemented a watered-down version that went towards prevention at Manual High School. And we, after that, Elite kind of got more money towards working with the young people in the school. So, Councilmember Velpula, we have been, as the mayor said, reacting and trying to enact preventative programs for a number of years now. Don't Shoot, when it came along, it was a watered-down version. We've never implemented a program that has had the amount of meat to it or potential that this program has. And, I would just suggest to council members, if we don't have to rush to judgment, do like we've done in the past. Let's visit cities that have implemented best practices. Let's go to Decatur and see firsthand. Let's go to Rockford and see the success they've had with ceasefire. And we don't have to go out and start a new group. We have neighborhood associations that want to see this crime problem solved. The police department and the community has come to the realization for years that you cannot hire enough cops to do this job. And you certainly don't want a program that's going to, have the name that's going to make it sound like we're going to be carrying guns all around the city. It has to be a comprehensive approach. And for the past 3 years, OSF, one of our largest employers, took over PCAF. Again, another approach to trying to deal with this community health problem of violence. We have group after group after group after group in the city that are ready to work. We've had church groups out on Western Avenue. Councilman Graham, I've seen groups out on McClure and Sheridan on Friday nights in previous years trying to deal with this problem. We've got individuals like Jesse McGowan, who's here tonight, who's been up on the East Bluff doing a lot of the dirty work. We don't have to reinvent the wheel. We don't have to name a new group. We have individuals who said, we want to deal with crime in our community. This is the first time in my memory that we have ever had an opportunity to put some real meat to the program. The police chief has said this is going to supplement, this is going to complement what they have been doing. So we don't have to approve it tonight. Let's do our due diligence. Let's go visit and see what ceasefire is doing in Rockford or in Decatur. I mean, we're standing around here like we're trying to do something new. We're just trying to put some meat into a problem that we haven't been able to solve for at least 10 years now or more. And so let's just do what we do as a council. Let's do the research. If you don't want to approve it tonight, let's go to Rockford. Let's go to Decatur. We've got groups out there that have said, I'm willing to work with you. I don't think Jesse McGowan would be here tonight if he wasn't concerned about violence. I don't think church group after church group, I don't think the East Bluff Community Center would be doing the things they're doing. So we're spinning our wheels like this is some brand new concept. So we don't have to approve it tonight. Let's just do our research. Let's do our homework. Neighborhood associations all around the city. We're tired of crime. We've got programs in schools. We've got OSF operating PCAV. We've got the health department. Who else are we going to call? I mean, we have resources available that have already been trying to do the work. This program is going to finally put some meat in it.
I just want to point out, we're not talking about program implementation. We're talking about an assessment.
No.
Councilmember Kelly?
Thank you, Madam Mayor. Just one question to anyone. Madam Mayor, you quickly dismissed the idea, I imagine, or I thought, of the health department being in the middle of this. I'm not carrying a brief for the health department or not, or I think they're fine. But they're a highly organized and well-trusted group in the city that is well administered, and it has a lot of experience. Again, I'm not making a case. Why is it that the health department would not be among those people who, or those organizations, who would head up this effort.
The health department would be a leader within this initiative. They may be a technical
I'm sure.
assistance. Yeah, absolutely.
Sure.
Yeah, they may provide technical assistance. Typically, you're going to have a community-based, because it is a community-based type of initiative. There's, you have to have the trust of the community. There has to be even what they call the street credibility. So that's one reason why you always typically engage a community-based organization.
You don't mean our whole community. You mean that little area that we're talking about. Is that what you mean?
What little area?
The area where this work would be done.
The target area. Yes. Right. There may be more than one target area.
I'm sorry, but that's what you mean by community. You don't mean the community. Right. Okay. I misunderstood that, okay, because to me this is a very credible organization in our community.
Absolutely.
So
no,
it's
yeah,
somebody in that neighborhood that is selected.
A community, somebody within the target, the people that would be hired would be people that live within the community.
I'm talking about the people who are going to run it, not
right,
the people who are hired.
Right. You're talking about individuals, or you're talking about organizations?
I'm talking about the people who are going to run it, not the people who are hired.
There's an organization that is a lead organization. Right.
And they come from that little neighborhood.
Not necessarily. They may not be based right there. They probably typically are based in the neighborhood. Mr. Decker, can you speak to that?
Yeah, sure. Typically there are organizations that exist either in that specific area or adjacent to it, or have kind of programming already existing there. And that's why, kind of using the data to determine like what are the specific hotspots, what are the areas that are going to make sense to serve as the target areas, and kind of from that vantage point, we look at what are the organizations that already exist, that already have some level of either implementation or programming in those areas. And those are the first that we kind of meet with to think, could they be a good partner to do this program?
Thank you, Madam Mayor.
You're welcome. Councilmember Rodrigo, you have wanted to recognize someone with a question.
Yes, we had a citizen, Jesse McGowan, who asked for the privilege of the floor to be able to ask a question. I think for the group here, either for Executive Director Hendrickson or maybe also for a speaker from Cure Violence National.
Mr. McGowan, can you come to the mic? Your name was mentioned when you stepped out. You had a nice compliment.
Well, glad somebody likes me. Jesse McGowan Jr., 707 East Thrush. When I first heard about this, I was concerned, and I would say I agree with everything they were saying. The problem is the thing that wasn't said. And there was more that wasn't said than what was said. Everything, we're all against violence. We all want to do well. I mean, all of that. The problem I have, though, here's my thing. Starting off with high risk. What do you consider high risk? Everybody has different interpretations of it. To me, a high-risk person is what I call forgotten kids. I haven't heard anything how they're going to identify those. One of the things I'm saying is we're going to talk to the stakeholders. To put this nicely, with present company, you stakeholders don't know what the hell's going on out there in those streets. I just been straight up. Well, you don't know what's happening out there. How are you going to recommend something you know nothing about? I can take you to, I got 25 people on my list that I would consider high risk. They're forgotten kids. They just forgotten. They're not in any program. They're not in school. They're not at home. Nobody knows where they are. Those are the high risk kids. But how are you going to get to those kids if you only dealing with the people and the stakeholders? The second thing is, and there was never given any clarification, how do you ID the workers? And there again, we're talking about stakeholders. I'm not on any stakeholders list. But there's very few things on East Bluff that I don't have some type of knowledge of. But nobody's going to recommend me hardly. So, I mean, and there's other people that like me. For instance, some people like ex-convicts. So how do we get those? What about the people that's doing work but not recommended by the powers that be? There are a lot of us out there that don't meet anybody's standards. Another thing we have, anything associated with the police will not build a relationship in the hood. It's not going to happen. You're going to have to get people like a Jesse McGowan or Terry Burnside or somebody that's, the first thing they're going to look at in the streets, street cred. Do you have street cred? The first thing, and most people are going to say, well, I've heard many of you all say the same thing. We didn't do this when we were kids. You lost your street credibility when you go to the street with that. They're going to tune you out just like that. They know you know what you're talking about. So I don't know what's wrong with these kids nowadays. You lost your street cred right there. So you're going to have street cred to build a relationship. We got relationships built all over the city with the kids as well as with the parents. So, and this brings me back to my initial reason. Assessment. I agree with all the other stuff. The $25,000 would be a big deal if we used it to implement the rest of the stuff on here. But for the assessment, $25,000 is a waste of money. We could use a lot more for it. If they want to do it, the training, the implementation, the talking to people, stuff like that, that's a great move. Assessments. LISC has done several assessments. Patrick Urick has done several assessments. Community Center, University of Illinois has done several assessments. Every one of them says basically the same thing. We know what the problems are. We know what is needed. What we are looking for and what we need most out here in the street are partners. You know, if you could come in here with this, the community resources are already here. We have the community resources. The assessment, it don't take 3, 6, 8 weeks. It take maybe a week. We can hook you up with us, with Patrick, with everybody that's done the assessment. The problem is still the same. They haven't changed. So we don't need to spend all this money on assessment. If we're going to use that money to implement some of these type programs we're talking about and working with people that to do the things that you're talking about, then I'm all in for it. But just for another $25,000, just for somebody to do another survey, we do this every 2 years. We have a survey, we'll talk about it for a year or two, we'll do another survey. As a matter of fact, I asked Patrick nicely, don't include me in any more years when he was doing all the things, those meetings before, because we're saying the same thing. So why are we going to pay $25,000 for the same thing that we already know, that we've already done? Let's see if we can get them to get past, to utilize the resources we have here to do the assessment, and then use that $25,000 to help us implement some of these programs. Then we got something we can go with then. But that's just my, like I said, I'm not against the ceasefire or the cure violence. I mean, I work with ceasefire, but I'm not against it. I just feel that we should redirect the money to be used in more a approach that's going to benefit the community rather than just somebody doing another survey.
Thank you, Mr. McGowan. And you are a stakeholder. All right, Councilman. Okay. Ms. Hendrickson, thank you for spending so much time with us tonight. I know it's your wedding anniversary, so we want to release you. We don't have any more questions right now. And Katie, thank you very much. Mr. Decker, thank you very much for your presentation. And I would ask for a motion to receive and file. Is Councilman Allen?
Motion to receive and file.
Seconded by Councilmember Jensen. And please cast your ballots. Motion passes unanimously. We have one more presentation. Mr. Manager?
Thank you. We have with us this evening Jen Gordon from Arts Partners to give us an updated presentation of the activities of Arts Partners. And I believe that we are getting the presentation loaded up as we speak.
Mayor, Jensen. We appreciate all of the support that we receive working with her in her capacity as city liaison with Arts Partners. This has been an extraordinary time for the arts industry and the arts community over the last 2 years. I know we've heard the word unprecedented more than we want, but it really has also applied to the arts community. And Arts Partners has worked tirelessly over the last 2 years to ensure that our arts and cultural sector here in Peoria moves forward without interruption, even despite the economic ripples that we've all experienced over the last 2 years. Since 1999, Arts Partners has worked to build awareness and strengthen the arts for the economic and cultural enrichment of Central Illinois. You can see some of our programs there: Sky Art Peoria, the Business of Art, Ignite Peoria, and Out and About. But really, our core value, what we believe, is that in Peoria, the arts are part of our brand. The arts are part of what make us thrive. When the arts thrive in our community, we thrive. And we can back that up with economic data. So it's not just a quality of life component that we're talking about, though it is. We have economic data to show that the arts is an industry that holds up our economy in ways that we really can't do without. In the state of Illinois, it's a $4 billion industry supporting 111,000 full-time jobs with $148 million in local and state government revenue that comes out of that. And in the greater Peoria region, it's a $20.4 million industry supporting the equivalent of 850 full-time equivalent jobs and generating $2.2 million in local and state government revenue. Now, you'll note that on this slide, this data is getting a little outdated. This goes back to 2010 when Arts Partners did a deep dive study on the economic impact of the arts. And I'm pleased to say one of our initiatives this year is to redo that study. We are actually launching a full-blown deep dive economic impact survey that is a methodology that is tried and true. It's passed on to us from Americans for the Arts. We have partners with the Illinois Arts Council and many other reputable organizations to ensure that we're using a really solid surveying tool. We're going to be collecting audience surveys from over 1,000 Peoria-based audience goers, and we have a core value to ensure that we're going to be collecting these surveys from organizations representing all facets and parts of our community. So that's being baked into our approach to this study. So I'm excited that the next time that I present to council, I'll be able to present you with fresh data that shows truly the impact that our local Greater Peoria region, the arts community here, the impact, the return on investment that we have. So you can see, again, this is going back to the last time that we had that data. And just to give you that sense of that breakout, that return on the dollar, for every arts organization that has an event, that has a ticketed event, what we saw in 2010 and what we certainly anticipate seeing when the study comes out in 2023 is a solid return on investment. So $16 per person above and beyond the price of that ticket, or if it's a free event, above and beyond, them coming into that event. So that plays its way out in local transportation, lodging, clothing, childcare, meals. But what we see is this breakout that the arts really do have a ripple effect on our local retailers, our local businesses, and it really does amplify this message of shop local in a big, big way. One of the things that I love about my job at Arts Partners is I get to work for and represent over 160 different arts and cultural entities. I'm going to say that again, over 160 arts and cultural entities. This includes ballets, this includes the Peoria Symphony Orchestra, which, as we heard earlier tonight, celebrating 125 years. For the breadth of Peoria's history, the arts has been there. And what Arts Partners works to do is to make sure that that continues to have a centerpiece in the narrative of who we are moving forward. And we've provided and will continue to provide critical support during unprecedented times. When I have people reach out to me and ask, well, how does Arts Partners differ from arts organizations? What we do is we fill a role that no one else can play. When the pandemic happened, we made a very, very sharp, quick pivot to working to find those COVID relief grants and to disseminate that information, to educate local arts organizations on how they could access it and get those dollars in the pocket. We were on the phone with the National Endowment for the Arts after the first CARES Act round of funding came out to discuss equitable access for small to mid-sized Midwestern communities like Peoria who weren't able to get access to the first round of COVID funding because of some barriers that they had in place. We also have been able to work with the DCEO on the Back to Business grant and many, many other different sources of funding that have really been critical during a season where our arts community has for many, many months seen dim lights and shut doors. Thankfully, we're beyond that, and we're so excited about that. But I'm really, really pleased to say that since COVID, and because of some of the work that Arts Partners has done, we've seen $1 million of ARPA and CARES Act funding get into the hands of Central Illinois arts organizations and cultural organizations. And we're really pleased and proud to be able to do that work on behalf of these organizations. A large part of what we do as well is building audiences, building awareness. I hear so many times that Peoria has so many best-kept secrets. I've heard that. Some best-kept gems. And at Arts Partners, we want to lift the veil on the arts and ensure that we are really connecting our community to the amazing arts resources that we have. On a weekly basis, we are reaching 20,000 plus people, and that comes through partnerships that we have with our wonderful friends at WCBU. We're able to produce 50 arts-specific radio programs on a yearly basis, highlighting arts organizations. And we also have e-marketing efforts to get the word out. Really excited about a new partnership that we started this year with WTVP that helps us to produce, at least for the first time in a long time, a monthly printed arts calendar that's going out to 17,000 people every month. Very excited about that collaboration. And on an annual basis, we're able to promote 2,000 cultural arts events each year. Now, yes, that number has dipped down since COVID, but we are so excited to see that reemerge. Some of our programs that, again, work to elevate the visibility of the arts in our community, we want to keep it in the front and center mind of everyone in our community, is our Art Peoria program. This has been in place for 8 years now, and just later this week, you're going to see a press release come out announcing this year's new winners. What's unique about this program is that it highlights local artists. It's only for local artists. It differs from other types of programs where people might be bringing in outside artists, but we're really pleased to be able to give our local artists a platform of this magnitude and size, 40-foot by 14-foot billboards by Adams Outdoor that are going to rotate through the Tri-County region for the next year. 30 million views annually. A project that I'm very excited to see return this year post-COVID is the Business of Art. And what this speaks to is really equipping our local artists for success. Peoria has an amazing story, many stories of artists who come here to study art at Bradley University, and they stay. And they decide to make Peoria their home. And because of the really critical small business and entrepreneurial resources that we have here, they're able to have successful startups. Through the Business of Art, Arts Partners is able to connect those artists with those resources like the Minority Business Development Center, the Small Business Development Center, the Greater Peoria Economic Development Council, SCORE Peoria, and I can go on and on. So that's, again, a critical role that we can play in helping to strengthen our local artists here in the region. Oops. There we go. All right, and again, I want to highlight this Arts and Economic Prosperity Report number 6 that I talked just really briefly about before. This is just going to provide our local arts organizations with metrics that then they can secure additional funding from granting sources. One of the largest challenges that non-for-profit arts organizations have is telling the return on investment when they're applying for funding from a variety of different granting sources. And so as we put together this piece, as we're collecting the actual data for the return on investment of the arts in the greater Peoria region, we're going to be able to package that in a way that all of the local arts organizations can then use for the next 5 to 7 years very effectively in their own advocacy efforts and in their own work to secure funding for their organization. And I passed over this slide before, but Ignite Peoria is going to be returning after a 3-year hiatus at the Peoria Civic Center. And I'm so excited that we're able to bring this project back with the support of the City of Peoria and the Peoria Civic Center and the arts and makers community. We already have 65 arts organizations committed to showing up on August 13th and providing experiential, interactive arts experiences. And why this is so critical, we know that after hibernation, after time behind closed doors, with our arts communities closed, we need to re-engage the youth in our community. We need to do it in a way that's accessible. And this event is really addressing that. It's free to the public, it's free to participants, and we can do that because of the support that we receive from the City of Peoria. So I hope to see you all out there on August 13th at Ignite Peoria. But before I go today, I also just want to encourage everyone who's listening today to safely re-engage with our arts community here. It's not only does it benefit our quality of life, but we want to see these arts organizations stay here for the next 10 to 20 years. We had a little bit of a unique situation where we did have a remarkable amount of grant funding coming from a variety of different sources that Arts Partners was able to help organizations navigate. For the most part, those funds are gone now, and now is the time for our community to start purchasing tickets again, to start volunteering, and to start engaging with their local arts community. Thank you, City of Peoria, again for your support.
Thank you. Great presentation, great information, and you've made your case, Ms. Gordon. Councilmember Jensen is the council liaison with Arts Partners. You will have any comments?
Well, I just wanted first to thank you, Jen, for all you do. For our arts community, we have a vibrant, strong arts community, and because of that, we have more and more people moving to Peoria. I know in our neighborhood, I think just in the last 2 or 3 years, 4 or 5 artists from out of state, from California and Colorado, have moved to Peoria because they want to be part of our vibrant arts community. So it's strong, it's growing, and that's a lot to do with you, Jen, and your leadership. I'm very proud of what you did during the pandemic, helping all of the art organizations secure the payday protection loans as well as the CARE Act funding. Without your leadership, we would have lost a lot of those organizations and those artists that help make our community so strong. So thank you for your work and your presentation. And I encourage everybody to, go to the symphony, go to the ballet, go to the First Friday events when the galleries are open and support our strong arts community.
Can I get a motion to receive and file?
I move to receive and file.
Seconded by Councilmember Euler. Any other discussion? Please cast your ballots. Motion passes unanimously. Thank you, Ms. Gordon. Madam Clerk?
We have one town item. 22-183 is a request from the town officials to approve the May 2022 actual expenditures and to approve the June 2022 anticipated expenditures for the town of the City of Peoria.
Can I get a motion? Okay. Moved by Councilmember Greb. Is there a second? Seconded by Councilmember Velpula. Any discussion? Please cast your ballots. Motion passes unanimously. Madam Clerk?
We are back to city business, and we are at the consent agenda. 22-184 is a communication from the Mayor and Corporation Council with a request to approve the declaration of local state of emergency. 22-185 is a communication with a request to approve the real estate sale agreement with Downtown Development Corporation for the purchase of 837 Southwest Washington Street, Peoria, Illinois. 22-186 is a communication from the City Manager and Director of Public Works with a request to approve the low bid from Krumholtz Brothers Landscaping, Inc. in the amount of $136,190 and award a contract for the Springdale Creek Stream Bank stabilization with an additional authorization of $13,619 for contingencies for a total amount of $149,809. 22-187 is a communication with a request to approve vendors for 2022 street maintenance materials to secure set pricing for the current maintenance season rather than market pricing. And on your desk, there is a handout with an updated communication. 22-188 is a communication from the City Manager with a request to approve a resolution authorizing intervention in a pending property tax assessment appeal before the Illinois Property Tax Appeal Board. 22-189 is a communication with a request to adopt an ordinance to amend Chapter 31 of the Code of the City of Peoria to make a technical correction relating to exclusions from the stormwater utility fee. And on your desk, there is a handout with an updated ordinance. 22-190 is a communication with the request to adopt an ordinance amending Appendix A of the Unified Development Code relating to a technical correction to variations within form districts due to a codification error. 22-191 is a communication with a request for the following. A, to approve existing property insurance coverages with Liberty Mutual Insurance through Alliant Insurance Services, Inc. at a one-year cost of $268,156, inclusive of fees. And B, to adopt an ordinance amending the City of Peoria 2022-2023 biennial budget relating to the payment of insurance premiums in the amount of $213,317. And that concludes our consent agenda.
Thank you, Madam Clerk. Are there any items to remove from consent? Councilmember Kelly.
Thank you, Madam Mayor. 22-188.
Okay. Any others? Councilmember Graham.
190, please.
Pardon me?
190.
190, okay. Are there any other items to remove? Can I get a motion to approve the consent without those items? Moved by Councilmember Ruckriegel, seconded by Councilmember Allen. Any other discussion? Please cast your ballots. Motion passes unanimously. Madam Clerk?
22-188 is a communication with a request to approve a resolution authorizing intervention in a pending property tax assessment appeal before the Illinois Property Tax Appeal Board for Best Buy at Big Hollow Road, Peoria, Illinois.
Councilmember Kelly?
Thank you, Madam Mayor. Actually, I'm not opposed to this item, but I want to highlight some facts that are contained within this item. There are two pieces of property involved here. One is the piece of property on which, or the land on which the Best Buy building is located, and an adjacent piece of property. I did a little math. This other piece of property is very similar. It's not developed, but it isn't, there aren't any cows on it. It's ready for development. It's grass. The assessed value of that other parcel is $4,990, or about $5,000, which means that the assessor estimates that its market value is 3 times that, which is $15,000. It's a little less than 4 acres. I worked out the math. That comes out to a value per square foot of 9 cents. 9 cents a square foot. Now, the land underneath the Best Buy building is, according to the assessor, it comes out to $3.86 per square foot. These two properties are right next to each other. They're very, very similar, good access, etc. The developed property has a per square foot value, according to the assessor, of 42 times the value of that vacant property. If that vacant property was valued the same way that the developed property was, it would have an assessed value of $216,000 instead of $5,000. The city, which now collects $55 a year from that property, would collect $2,300 a year. Now, I bring this up not because it's an isolated case that we need to have a look at. This goes on all over our city. All over our city. Vacant land owned by this person, that person, whatever. They go to the Board of Review. They get the assessment reduced to ridiculous values. And then they put a sign up. The best example I can use, this is not a vacant piece of property. When Emos, the owner of Emos decided to sell, the assessed value on that property was $29,000. They put a sign up that they were willing to sell for $2.1 million, which is probably a fair price. It's a great location, etc. I bring this up because who creates that land value? It isn't me, the landowner. It's the community that creates the land value, both public and private. Okay? You can take the lot on which my house sits, and its intrinsic value is enough to feed maybe half of a deer a year. Everything beyond that is because of the community around it. Okay? And we let these things go this way. I told the city manager there's an interesting way of assessing properties that Hong Kong uses, which would be illegal here, but it kind of shows. In Hong Kong, you self-assess your property. You say what the property is worth. But there is a catch. The government of Hong Kong can buy your property anytime it wants for what you say it's worth and rent it back to you or sell it back to you. Okay? Everything in Hong Kong is overassessed. This goes on all over our city. It isn't just in bad neighborhoods. It isn't just in places where people don't want to invest. It's in lots and lots of places that are really highly valuable pieces of property. And we charge people nothing to sit there year after year after year after year while everything else, everybody working, everybody investing, everybody doing all this stuff around them are adding to the value of that land. That's not right. It's costing us money. I don't blame those people. I blame a bad system. We have a bad system. And the fact that people take advantage of it cannot be surprising. So with all that in mind, I will move to approve.
Thanks for the insight. Is there a second? Seconded by Councilmember Valpula. Any other discussion? Please cast your ballots. Motion passes unanimously. Madam Clerk?
22-190 is a communication with a request to adopt an ordinance amending Appendix A of the Unified Development Code relating to a technical correction to variations within form districts due to a codification error.
Councilmember Greb?
Yes. Could I have an explanation on this one?
Good evening. Probably about a year and a half or so ago, we had a text amendment brought to you that was approved by the council and ultimately codified by Muni Code that we didn't catch until most recently in error. And this is to correct that, which if we had caught real quick, it wouldn't have had to come back through your process as an ordinance approval. But because of the length of time that's transpired, we're bringing this back to add language that should have always been there and then correct an inappropriate or incorrect language from special use for properties in the form districts to variance process, which is the correct requirement, variance.
Okay, give us an example. What does that mean?
So if a property comes before us for development that doesn't meet the regulations of the form districts,
Like on Main Street?
like on Main Street or the warehouse district, if they don't meet the regulations, the process for relief is through the variance process, which is an application to the Zoning Board of Appeals. And that's the correction before you today, instead of the special use process, which is incorrect.
Yeah. Is it a difference without a distinction, or is there some internal illogic causing us to have to do this?
The difference between special use and variance?
Yes.
Is that the special use process is a application to the Planning and Zoning Commission as a reviewing body that then makes a recommendation to you. The variance process is solely through the Zoning Board of Appeals, and they make the final decision. And so the Zoning Board of Appeals has a set of criteria for variances that they review and vet through to review whether a waiver or a variance should be approved. Special use, again, has criteria, but it ultimately is your decision.
So does this move more of the decision-making away from the council and toward the ZBA?
Correct. A variance is a determination by the Zoning Board of Appeals and not council.
And now that, the ZBA, is one of those elements within our city government. When they make a decision, that decision is non-appealable, correct?
It is appealable, but it goes to the circuit court, and it's not appealable through
Right.
council.
Why is it important that we do it this way instead of the other way?
I think when we brought this forward to you a year and a half ago, the thought was that the regulations as are currently written that should be met, when they are not met through our review, the variance process has set standards that are well defined in our code, and we felt that it was appropriate to have, as with the entire city, not just form districts, but the whole city goes through the Zoning Board of Appeals. So our recommendation at that time was to make it uniform. Whether you're in a form district or not, a variance is through the Zoning Board of Appeals. If it's a special use, then that's unique to a form district for variances. Does that?
If the council, for example, really wanted a development in one of our form-based districts, it would no longer have the option of approving a special use permit. We would be basically, depending on your point of view, at the mercy of the ZBA.
For items that do not follow the code of the form districts, correct. The ZBA would have the authority to alter the regulation, to modify the regulation, correct.
This makes me a bit nervous because I can think of so many times we've needed to take a look at our rules and see if we really wanted them slavishly applied in a particular business's case. We're a very dynamic city. Things are changing. Manager, do you feel, can you contemplate, sitting where you are today, something that would come back and bite us if we have some really neat development that's coming into one of our form-based districts and the ZBA doesn't like it? The elected body at that point is out of the picture. We then have to go, they're turned down, and we think it's a good idea to the circuit court to overrule the ZBA. I mean, I'm just nervous about this one.
Well, I think that there certainly could be a case where that could happen, but I think what staff has been trying to develop is kind of a series of objective standards that we can fall back on here and then go to that body using the variance process in order to just make it more consistent throughout the entire city. Again, this is ultimately, there's a certain amount of policy decision, or room for council to decide which way you want to go with these specific types of issues as they come forward.
Form districts exist for a reason, and they're not everywhere in the city. And what are some of the areas where we have form districts, Assistant Director?
Washington Warehouse Farm District, which is our riverfront general area. Got Main Street, Sheridan Triangle, and then Prospect. So we have 4 form districts. Specific defined areas.
And, for example, if someone wants to build something in the warehouse district or on West Main, can't be just a one-story structure.
Correct. There were standards built in those form districts to say this is the way that we want the development to look specifically to create those guidelines for that area of the city. Giving up some of the other standards that we would follow in the normal development process. So meaning that a property owner can do more things with that building as long as it looks within that same character of the form district.
That's correct.
Yes. I'm not going to support this because I don't know when in God's good time it's going to happen, but I believe there will be a situation where we're going to be sorry that we don't have a chance as a policymaking body to make a decision that would encourage development and instead throw something to an unelected body where it's a non-appealable decision, no reflection on who's on that ZBA. But I think this is moving government farther away from the elected representatives of the people. And so I can't support it. And I know some of the form districts are in District 2 and 1, and I think 3 too. I don't believe we have any in 4 or 5 right now. So I think we're removing some flexibility here that we should have in the future. So I will be voting no. I move to deny.
Is there a second? Okay, motion fails. Councilmember Jensen?
Thank you, Madam Mayor. I just want to seek clarification. Weren't you just cleaning up the language because it referenced variance process in Section D?
It is
that it's always been a variance. It's never been treated as a special use. Isn't that correct?
Actually, several years ago, it was a special use. It was, and then a year and a half ago, we made the correction or the text amendment before you to the variance process. At that time is when the codification wasn't done appropriately, so we currently have 2 sentences in this same section. One says you have to go through a variance, and the other sentence right below says you have to have a special use. So we've got conflicting regulation right now that this was trying to clean up in reflection of what you approved a year and a half or so ago.
So a year and a half ago, we approved to make it be a variance.
Correct.
And this just got overlooked.
Right, right. It didn't get on in print as it should have.
And it might be helpful, can you give an example of like a recent application for a variance so the council understands what, usually it's just to get maybe extra feet from the setback or things of that nature that are pretty routine?
It can vary. It could be a setback, which is a distance. It could be a height of a fence. It's anything with a bulk regulation. The one thing we cannot approve a variance for is use. So it's anything that has a dimension to it, or that we can measure. And if there's an application that says, "Hey, I can't quite meet this regulation," that's where the variance can come into play, where there's review, and if there's a hardship, or if there's something that prevents the development from meeting that requirement, then a variance can be approved.
The standards for a variance are set by actually state statute, which the city has codified, and there's a number of factors.
Correct,
that
and we
come
actually
into
have
play.
3 types of variances. We've taken it a little bit further. We've got we've got administrative, where it's just staff because they're really small. We've got minor variances, which are about 20 to 50% of the regulation. Then we have a full-blown major variance, which is 50% or more, which is your larger variance.
And the intent of this, when we adopted this change a year and a half ago, was to more streamline the process and make it more
And consistency.
business-friendly.
Mm-hmm. And consistency with with citywide. Because prior to this, form districts were the only area that a special use was required for a variance or for a waiver. So this change made it uniform for the entire city.
In every other place of the city, you come in and get a variance when you want a waiver from the code.
Correct.
Okay. I fully support this. I think it is a good idea, and we already approved it a year and a half ago, and this is just really an administrative cleanup to make the language consistent with what the intent of the council was. So I move to approve.
Is that did you make a
Yeah,
motion?
I move to approve.
Is there a second? Seconded by Councilmember Kelly. More discussion, Councilmember Graham?
Form districts are different. When one wants to build a gas station, for example, outside of a form district, it can be one level. It can be just like a ranch in terms of the way it appears to be. We have form districts for a reason, and we want development to look a certain way along the form districts, yet we want to also have flexibility. Assistant Director Allison, can you refresh the council on when we last did a special use permit in a form-based district and why we did it that way?
Oh boy, I would have to. I'm drawing a blank at the moment. I can't think of one. There was probably one on Main Street.
I think so.
So yeah, but I can't think of a specific.
Would it be Main Street Commons? Was that one that was handled by special use?
I believe so. Yep.
Yeah, and that was a major development back in 2010.
Yep.
Well, okay. I can see where the votes are, but if I weren't the council person for much of the geography where these exist, I wouldn't be so interested in making certain you don't relinquish the oversight that you should have, in my opinion. Thank you.
You're welcome. Thank you, Assistant Director. Councilmember Euler.
Thank you, Madam Chairwoman. Just for the sake of commentary, I will support the motion because I think we need to clean up the ordinance. However, I don't necessarily disagree with Councilman Graham, and that could potentially be another topic of conversation for a different day. But I think for today, we just need to clean it up. But I'm definitely not opposed to what you're saying, Councilman Graham. Thank you.
Welcome. Okay, we have a motion and a second. Any other discussion? Please cast your ballots. Motion passes with 1 nay. Graham. Madam Clerk?
We are at regular business. 22-193 is a communication with a request for the following. A, approve and authorize the execution of a contract with Delta Works in the amount of $183,222 with $86,206 to be paid by ETSB to administer CAD RMS consulting services, and B, to adopt an ordinance amending the City of Peoria 2022-23 biennial budget relating to the use of capital fund balance in the amount of $183,222 for CAD RMS consulting services, and we'll need 2 separate votes on this item.
Okay, Mr. Manager?
Thank you, Madam Mayor. The item in front of you this evening is for us to hire a consultant to do the work to replace our CAD and record management system within the ECC. We have our interim director, Brandon Blaney, is here with us this evening. The CAD system is the brain inside our emergency communications center. It is what keeps our information flowing. It gets our emergency vehicles where they need to go, and it makes sure that our telecommunicators and dispatchers that we have inside the ECC have the information at their fingertips to help our men and women of our police and fire departments. So it's an important system. The records management side is really ours, so that's the difference that we have with that. But I'm going to, maybe if I could, just turn it over to Director Blaney to just talk a little bit about the importance of the system.
Yeah, thank you, Mr. Manager. Yeah, you hit that. It's the foundation of every emergency call that comes through for police, fire, and emergency medical. Every call for service is entered into that system and then dispatched through that system to our first responders. Then that data is transferred to the records management system that the police department currently uses to write the reports. Currently, the fire department does not use the system that we are on due to some deficiencies, and so the goal is for us to have both services, police and fire, under the same system as the dispatch center so that everything flows clean as possible.
Okay. Thank you. Any questions? Can I get a motion to approve A, moved by Councilmember Euler, seconded by Councilmember Ruckriegel? Any discussion on A? Councilmember Kelly?
I'd just like to correct the record. I hate to correct the city manager, but the brain in the system is at the podium up there. It's not the software. Thank you. Thank you, Madam Mayor.
Welcome. Please cast your ballots. Motion passes unanimously. I have a motion to approve B, moved by Councilmember Graham, seconded by Councilmember Jackson. Any discussion? Please cast your ballots. Motion passes unanimously. Madam Clerk?
22-194 is a communication with a request to adopt an ordinance amending the City of Peoria 2022-2023 biennial budget to include $45,000 for a mailing to municipal aggregation customers.
Mr. Manager?
Thank you, Madam Mayor. I think all of council is aware that while we tried to secure an energy contract, we were unsuccessful. So for the next year, our 38,500 households and small businesses will have to jump onto the Ameren published rates for energy for the next 12 months. With that, certainly customers can look and see if they want to. They can go out to pluginillinois.com, which is the ICC's, the Illinois Commerce Commission's website that shows the various rates. Unfortunately, most of those rates are actually, when you plug in your zip code with the providers, are showing that the rates are running at the 16-cent per kilowatt hour rate, so it's even higher than Ameren's published rates at this point in time. So because of that, because we have 38,500 households that we buy energy for, we'd like to send a postcard out to everyone, informing them of the situation, informing them what to do, and, letting them know where to go if they want to try and find an alternative provider. And the cost of mailing is roughly, we estimated $45,000 here. It may not be that much if we send out a postcard to everyone, but we felt that this just gives us a cushion as we look at developing that mailing.
There's a lot of confusion out there, and I think they need some information from a neutral party. Yeah. Councilmember Jensen?
Thank you, Madam Mayor, and thank you for bringing this forward. I think it's a good idea that we get this communication out as soon as possible, since the public is confused about this. If you would, could you briefly, for those that weren't present during the meeting, at our last meeting when we had representatives come from, what is it, Good Energy? Can you explain why we weren't able to get a bid and get the lower rate?
Well, I think that primarily the timing of when our contract expired and when that was coming to an end after the recent capacity auction that came out in April, coupled with rising inflation, coupled with rising gas prices, coupled with the war in Ukraine, led to a lot of uncertainty in that energy market. And so the energy costs right now, when when you're buying electricity, you can follow the market and it will go up and down, or you buy it and run that for a set period of time. When we talked with Vistra, which is through Homefield, and when we talked to Constellation Energy, both said that the market was just still too uncertain for them to give us a price that was below Ameren's price to compare. So that's the reason that we're at this situation. Our contract ended at the end of May. So since we couldn't execute that contract in April, we waited to see if we could do that in June. It did not work, and under Illinois' municipal aggregation law, if you're off for more than 2 months, you have to stay off for an entire year. So that's the reason why we have this full year that we have to follow.
Okay, and the mailing will include a website that residents can go to see if there's another company that they could get a better rate at.
Yeah, but like I said, I mean, right now the rates are, there's nothing that's lower at this point in time.
Right.
It's actually all higher.
Right.
So.
Thank you. And with that, I move to approve.
Is there a second? Seconded by Councilmember Allen. Any other discussion? Councilmember Kelly?
Thank you, Madam Mayor. I'd just like to point out that we don't have any electrical generation in our area anymore. We used to have plenty. And these were shut down before Ukraine, before inflation, before any of that stuff. So we don't have any generation around here, which was, I don't want to get too ideological here, but I think that's our problem. And I think we need to see what we can do about that. Thank you, Madam Mayor.
Mr. Manager?
Well, I think that yes, some of the coal-fired plants did get shuttered here in the Midwest and in the 9 states that are part of the MISO buying group. But I think the market was also sending signals to them that with the rates that we were able to benefit from over the last 4 or 5 years, we had very historically low energy rates. And that sent signals to the market that we can shutter some of these plants. And now we're seeing the situation where we don't have the capacity. And while the market may have been pricing it at a certain level, now that price is considerably higher.
Okay. Thank you. Seeing no other discussion, we have a motion and a second. Please cast your ballots. Motion passes unanimously. Madam Clerk?
22-195 is a communication with a request to receive and file a report back related to the City of Peoria Land Bank and purchasing properties from the Peoria County Trustee Auction.
Mr. Manager?
Thank you, Madam Mayor. I'd like to turn the floor over to Director Doolin to follow up on this report back.
Okay, Director?
Thank you, Mayor. Thank you, Mr. Manager. If you recall, on May 10th, Councilman Kelly asked us to do a report back regarding some of the things he had been meeting with staff about that came from, actually branched off from discussion about the rental registration process, and this was a continuation of those discussions. And part of that discussion through that group came to a discussion about the Peoria County trustee process and what that process means for our city as a whole. And so we thought it prudent, based on that request and based on the information, to provide a report back to council that summarizes some of the work that we've been doing in community development, specifically focused around our work at the land bank and also our work with the county trustee process to date. So the report in front of you highlights some of the work the land bank has been doing. Our land bank is very unique and not a traditional land bank in a sense of what we do. There are land banks, about 11 or 12 now throughout Illinois, but most of them are run at a regional level, not city controlled. And while that process has some pros and cons, I think it's really a benefit to us because a lot of the vacant land in this area is in the city of Peoria. So this gives us direct control over the outcomes with that land. Our land bank is also really a long-term strategy on how we can address some issues in our community that have not developed overnight but have been through deterioration and a really flawed property tax system in the state of Illinois that has created this system specifically in weaker markets throughout our community. The tax system is designed to really spur market investment when property taxes aren't paid by having people step in who want to purchase back taxes to hopefully take over that property in the future. Unfortunately, what we see in areas where property doesn't have the value, you have tax purchasers who may buy them with no real intent to ever take over the property. And then you have properties that no one buys, so then they are put in the hands of a county trustee who represents all of the taxing bodies in our community. What we found through our discussions with a couple area landlords that I want to thank and appreciate for working with us is, done correctly, someone can run a successful rental business and provide quality housing throughout the community, no matter what neighborhood they live in, if done correctly. Where you see issues is when someone thinks they can purchase a property for $900 and then put someone in there without making corrections. What we have found in almost every case since I've worked with the city that a property purchased for $900, the market does not support rehabbing, unfortunately. The investment of $30,000, $40,000, $50,000 to make that quality housing just isn't there. If that's the case, someone would have purchased the taxes and bought the property. So with that said, I know Councilman Kelly and the group had originally discussed kind of a blanket purchase of county trustee properties. I think at this point that's not necessary. We are in a very good situation where the land bank has developed a very good partnership with the county treasurer, who is a part of the land bank, in making these incremental changes of how we stop this process from happening. Last year, for the first time since I've been with the city, and probably before that, the county treasurer allowed us to remove the properties from the auction that were demo candidates. So we removed 37 properties from the auction that were demo candidates that likely would have sold for $900, and someone may have moved them in and would have started this process over again. When we talked to some of our municipal partners throughout the state of Illinois, they don't have as positive relationship with their county treasurer as we do, so we're very lucky that they allowed us to do that and allowed us to make headway in demolishing those structures as well. Luckily, we were in a good position with our American Rescue Plan money that we have a substantial investment to make in demolition. So while we don't make a across-the-board recommendation to purchase all of the properties from the county trustee auction, and that has to do with a couple different things. Because of the relationship we have with the county treasurer, we can make strategic purchases. There are some properties that we just don't have any interest in owning because they're orphan parcels that are a retention pond of a neighborhood that just adds additional city liability for us owning. There's really no good solution for them for any time, but and we might still have to maintain them, but us actually owning them just creates a liability that we'll have kind of indefinitely. So while we don't make a recommendation to purchase them all, we did want to offer some recommendations and more just provide our long-term strategy to what we're moving forward with the land bank, and just kind of have council receive and file this report to make sure that we are headed in the right direction and are trying to accomplish the same goals that council is. So within the receive and file report, we did highlight some recommendations that we hope to do moving forward. One of those is to continue to purchase properties that have strategic value of the city before they go to auction, specifically in areas of town where we might have a group of properties already together that we can kind of complete half a block, complete a block. We know it would be a good side lot for a neighbor that's doing that. Strategically pull those from the auction to ensure we get good quality development going forward. Continue working with the county to make sure that properties sold at the auction, they're not selling ones that need demolished. Stopping someone from purchasing a property that needs demolished, similar to what we did in the last auction process, prevents us from having to do code enforcement at that property in the future. You know, demolition is the last thing we want to do to a property. It removes it from the tax base and really creates a hole in the neighborhood. But unfortunately, through years of disinvestment by negligent property owners, that's the only outcome that can be a good outcome for the neighborhood, is demolishing that property. 3 is kind of work with the county to really encourage them on properties that we don't buy to vet property purchasers. One of the, I think, things we saw due to COVID, that this isn't a unique challenge to the city of Peoria. It's actually a challenge cities throughout the country are facing, is so many property purchases are going online. So it opens up the market of purchasers to anyone with a computer. So people see a property for sale for $1,000 and they think, I'm going to own this house, because you know there is that American dream of home ownership. And when you're living in a city like Seattle or San Francisco and the housing costs so much, you think a house might be worth $1,000 and you can make investments. But what we found is I haven't found people who've bought houses like that in our older neighborhood for $800 or $900 who actually moved here, corrected the problems. Instead, we find ourselves back in this cycle of they stop paying taxes, they're not mowing. So just really encouraging our county treasurer and the county process to really vet property owners before they purchase properties, to ensure that we do limit, while we do want access to people to purchase these properties, sometimes the highest bid or sometimes any bid isn't the best for our community. So just working with the county treasurer through the land bank to create a process that can vet property ship owner before people purchase property in the city of Peoria, specifically when they purchase public property. Number 4 is to take a more aggressive approach to the abandonment statute that's within state statute. Through the Illinois Housing Development Authority Land Bank program, they funded, that's where a lot of these land banks have started over the years, and they've really brought this issue forward in Illinois about vacant and abandonment. Through that, one of the things we also lobbied our legislators that were supportive of, and the group lobbied their legislators, was to tweak the abandonment criteria for properties. We have been using this statute throughout the last 8 or 9 years to get some properties. However, there's some discretion about how you define the statute about an unsafe and dangerous building that sometimes ran into some hiccups. Well, the state of Illinois changed that criteria to loosen up a little. So it's still a work in progress, I think, to provide education about the statute and the deterioration of these properties to our judicial branch. But we are working on it. I have met with our legal department after a few road bumps, I think, with how we presented our cases, and I think we have a path going forward about bringing a separate count unrelated to a dangerous building that might put the judges more at ease to grant us the abandonment criteria, with the ultimate goal of getting these properties before they need demolished. If a property sits 4, 5, 6 years, it's probably to the point where it's gone, where if you get it at that 2-year mark where it's been abandoned, you can hopefully get it, you can hopefully turn it back into a positive aspect for the neighborhood and make it a home ownership opportunity for someone. Number 5, we talked about the discussion of, we run into this with multiple properties throughout our community. Someone is behind on their property taxes, so they want to abandon the property, and they make a call to the city, can I donate this to you? In some situations, we'll say yes, but when the property tax bill is $9,000, the city right now has to pay that $9,000 to clear the back taxes. If our end goal is to demolish it, we know we're going to have to spend $13,000 anyways to demolish it. So now on this vacant piece of property, we're in $22,000, so the other taxing bodies can be reimbursed for the back taxes. So one of our recommendations and suggestions is to approach them specifically on land bank purchase properties. If we can have some sort of intergovernmental agreement, whether it's allowed or not, that's what we'll be working with our legal department and some of our consultants on the land bank to really abate the taxes for land bank purchase properties, specifically with the goal of being able to get those properties sooner and getting them back on the tax rolls. And that's our ultimate goal with any of these properties. If we can get them sooner and people donate them to us without us having to take a financial hit to a property we have to maintain, we can put it back on the tax roll, which is a win for all of the different taxing bodies compared to a vacant lot. And the last recommendation is just we're in an interesting situation with our more demolition funds. I think as we get more and more properties through the abandonment process, we'll have the opportunity to hopefully rehab more properties. But sometimes it's going to take some incentive to actually encourage a responsible investor to do that. So if the city is going to have to demolish a property at $11,000, $12,000, $13,000, if we can use that to encourage a responsible property owner as some seed money to rehab that property, I think we can then save it, keep it on the tax rolls, and keep it a positive piece of our neighborhood. So that's our report back. It's kind of our direction that the land bank is headed. Matt Smith with us is our land development manager. He's been with us for about a year now and does a fantastic job doing kind of the legwork of all these things. And I do also want to thank our land bank board. They've done a fantastic job working with us on these issues. Councilman Jensen, Councilman Euler, and Councilman Jackson are 3 members of the land banking board. And then the last thing I want to mention as a kind of a plug, the land bank is also running our down payment assistance program that we recently launched. Specifically within our qualified census tracts, you can get $5,000 in down payment assistance. Anyone who's listening and interested in that, go to appreciatepeoria.com. Appreciate the work with the local lenders and the Realtors Association to publicize that. But you know, one of the keys to our older neighborhoods is really encouraging home ownership, and I think the program specifically designed for our qualified census tracts is a big step in that direction.
Thank you, Director. Councilmember Kelly.
Thank you, Madam Mayor. And Director Jewell, and I want to thank you for the excellent report. And I would just like to say to the council that Director Doolin and Mr. Smith, Matt Smith, I'm sorry, I don't know your title, head of the land bank, but okay. We have been meeting with a committee of almost weekly with landlords. We've also had Councilwoman Jackson attend and Councilwoman Jensen attend, and we've hammered out these items. This isn't going to bring about the millennium, but I think it's going to make things better in our city, and our committee is continuing. And our next meeting is next week. And again, any council person who would like to attend is welcome. But I think this is a very good first step, and I would move to receive and file.
Okay. Seconded by Councilmember Jackson. Good strategies. Thank you for this information. Any other discussion? Please cast your ballots. Motion passes unanimously. Madam Clerk?
We are at unfinished business. 22-167 is a request by Councilmember Kelly for the following. A request to reconsider item number 22-167, which is a communication from the City Manager and Chief of Police with a request to approve $25,000 for a cure violence assessment to be paid from the American Rescue Plan Fiscal Recovery Funds. And we're going to need 2 motions on this item.
Okay, and just for clarification, Madam Clerk, on the request to consider, the motion and the second have to be by what's considered the prevailing side?
That is correct, yes.
Okay, thank you. Councilmember Kelly?
Thank you, Madam Mayor. I would like to reconsider item number 22-167.
Is there a second? Seconded by Councilmember Velpula. Any discussion? Councilmember Euler?
Thank you, Madam Chairwoman. Start by commenting that Jesse McGowan Jr.'s comments earlier were spot on, and that's a big part of why I would not be willing to reconsider this item. To reconsider it, I should have some material difference in the information that I was provided when the vote was taken, and the things that we were asked for were not provided. I asked for, and several members here asked for, the ability to see all of the programs that were presented to the SNET as options presented to us, and that didn't happen, and it came as quite a surprise to have a presentation on one desired item but not the rest of the items, and I liken that to being presented with our budget with only half of the information in it. We spend months deliberating the budget, and I realize that crime prevention is a critical issue here and needs something done quickly, and we can't spend months on it, but we also can't make decisions with a lack of information. Last night, Councilman Graham and I were at a neighborhood association meeting, and someone asked us why we voted against crime prevention. Well, once we explained why we voted the way that we did, it was unanimous in the neighborhood association that they don't want us voting to spend their money when we don't have all of the information. We wouldn't do that on the budget. We wouldn't do that on other issues. We shouldn't do that here. For the number one issue that we have in our community being crime and preventing it, stopping shootings, helping our neighbors, to not have all of the information and be the decision makers at the table when it comes to spending money, it is just absolutely wrong. And I have no different amount of information when it comes to the request that I made at the last meeting and the vote that I took at that time. And I think that this is a mistake to do a reconsideration. I think that there should be a policy session where we get the information that we need to make an educated decision. Because at the end of the day, it's the citizens that are going to hold us accountable, the 11 of us, not the guy that was on the phone earlier, not the person that's in charge of the health department, not the people that are providing grant funding for these projects. It's the 11 of us. And if this doesn't succeed, I don't want to say back to the citizens of this community that I wasn't in the room to hear the alternatives, that I voted to spend their money on something that I didn't hear the alternatives, and I absolutely will not do that. I think that it is a high priority for us to address crime in our community. It is a high priority for us to figure out what of these solutions are the right ones, but I will not do it without the right information, and I will go to the voter and tell them next year that this is absolutely the reason why I voted this way, that I have a fiduciary responsibility to them to spend their money knowing exactly what I'm voting on, and right now I do not, and I cannot do that, and I will not reconsider without the information that I asked for to be able to do a reconsideration. Had I been provided that, I would gladly vote on a reconsideration. Had we been provided the information that we needed to make educated decisions for the future of this community, I would be completely on board. We have to address this issue, but doing it in this manner is wrong. Thank you.
Any other discussion? There's a motion and a second to reconsider. Councilmember Kelly?
Is it legal for me to defer? To move for deferral?
At this point, Councilman, there is no active item on the floor, so until the motion to reconsider is passed, there is nothing to defer.
That would be item B.
How can we get around this?
If item A passes, on item B, there can be a motion to defer.
We cannot defer the motion to reconsider.
Rule 26 of your council rules indicates that the motion to reconsider has to be done at the motion where the item was voted on or at the next regularly scheduled meeting. There is no provision for it to be deferred.
Thank you. Thank you, Madam Mayor.
You're welcome. Please cast your ballots. Motion passes with 2 nays, Graham and Euler. Item B, Councilmember Kelly.
I would move to defer item B for till our next meeting.
For the next council meeting, and seconded by Councilmember Jackson.
Okay. Speak.
Discussion. Councilmember Graham.
Yes, Madam Chair. Would it be possible for us to take a peek at some of the, which the memos have referred to, not only this time, but last time, some of the alternative programs that are out there that we might consider in place of or in addition to CVG?
There was, I don't remember how many proposals that were presented. Most of them were not considered evidence-based, but I can certainly send you I sent the email to one council member. I didn't hear the request from, that was referred to by Councilmember Euler, but I'm happy to send that memo.
Because what I'm hearing everywhere I go in the city, everywhere, is we have to do more to prevent violence with our kids. We need to have a more strategic approach, and we have to stop the catch and release situation. And we have to work perhaps with our judges and our state's attorney to do that. I noticed where a car was wrecked recently and the child was released to the mother. Really? Seriously? That's what's happening in Peoria. And I can't go into any neighborhood in this city, Mayor, without somebody telling me in any given neighborhood that their car, they've had an attempted break into their car at least once in the past year. It's shameful. And a lot of it are kids. So that's why, Mayor, I really, really would like to see something. Now, I understand CVG could get down to peer counseling with juveniles. But I'm hearing that they want something more specifically laser-focused to deal with children who are involved in way too much violent crime here in our city. And I don't suspect they're giving up on some of the older people who are doing drugs and doing intrinsically evil acts, even though the health department model doesn't want to say there's anything that's intrinsically evil. That's a problem I have, too, with that model. And we shouldn't speak of acts being senseless. That's old-fashioned. But what I'm hearing is a lot of acts that are being committed in this country and in this city today are senseless acts. Maybe that's the old-fashioned way of referring to it, but it's true. And there are some things that are just morally indefensible. And the catch and release, I'm sorry, it's destroying our city and other cities that are doing the same thing. So we want to say, well, we can't law enforcement our way out of it. Well, yes, we can And if we believe that law enforcement wasn't the key factor in terms of making all of us safer, why don't we just give all of the police department budget to the health department? You say, well, that's silly. So obviously we do need a mix, but I'm just not convinced that the base assumptions underlying CVG are what I can support, and that's why I'm encouraging you, I'm imploring you to bring SNET out of the shadows.
It's fully open in July.
And it should have been up to now. And that way we can get more community buy-in and see things better. And I can't imagine why we wouldn't have been doing it all along. But nevertheless,
I'm glad to talk to you about
we
that.
all make mistakes.
I don't call it a mistake, but I'm glad to talk to you about
When
it.
you talk about crime and delinquency in Peoria, and you have a group that is operating in the shadows, and then all of a sudden we have something brought to the council floor, and we're asked to approve it with, I think, crazy assumptions about human behavior, and talking about, well, they're going to do the dirty work we don't want to do. I keep hearing that. I keep wondering, what are we talking about? So that's why I really want to see something that would be an alternative to this, because I'm absolutely unconvinced that this is good for Peoria as it stands now, and that's why I'd like to see some alternatives. So, you guys are free to bring it back or not bring it back, but I'll vote accordingly.
Thank you. Councilmember Kelly?
Thank you, Madam Mayor. I'd just like to speak to the motion. Tonight was the first time that this council's been apprised of this program. That also means that tonight is the first opportunity that the public has had to review this. This is of course, the issue itself is very important. And our response to this issue is fraught with lots of learning and probably lots of assumptions as well. And I think we need time to digest this stuff. I think Councilman Graham makes a good point in that there are other programs. This is a worthwhile program as well. Perhaps there's one that's better. Perhaps we can do a combination of ingredients. We need some time to chew on this with real data, with questions back and forth, etc. And any decision we make, and the public needs a chance, I think, to respond. And anything we can do to encourage that system, which is our system, I think is good. And so I made the motion. I'll obviously be voting for it, but that is why I made the motion. Thank you, Madam Mayor.
Welcome. The motion is to defer item B until June 28th meeting. Please cast your ballots. Motion passes unanimously. Madam Clerk?
22-174 is a communication with a request to concur with recommendation from the Planning and Zoning Commission and staff to adopt an ordinance approving a special use in a Class R2 single-family residential district for a short-term rental for the property located at 1506 West Teton Drive.
Mr. Manager? Yeah, it says manager.
Thank you. I'd
Yes.
ask maybe Director Doolin to come up and explain this.
Okay.
Or Assistant Director Allison.
Thank you very much. This is a short-term rental on Teton that was deferred to allow more opportunity for Councilman Allen to speak with the neighbors and to try and resolve some of their concerns and issues. That meeting, there was actually 2 meetings held to address that. So if there's any questions, the proposal before you is not changed. It's for rentals of short-term rental with 1 dwelling unit. The property owner would not reside. That's why it's before you as a special use.
Councilmember Allen?
Thank you, Madam Mayor. I would actually like to give privilege of the floor to citizen and resident of Willow Subdivision, Ms. Kathy Matlock, to come to the podium and address the council. Thank you.
Hello. Thanks for letting me speak to you this evening. My name is Kathy Matlock, and I live at 6704 North Redwood Court, which is in Willow Knolls South Subdivision, which is where this house in question is that wants to become an Airbnb. That's what it is, Airbnb. They call it short-term rental. We moved to this house 24 years ago with 2 children. We had 2 more children there. From the time we moved in, we became very active in the neighborhood. We were in every park cleanup. We were at every pool cleanup. We went to movie nights in the park. I was on the board for multiple years. I ran the pool for several years. We had Easter egg hunts. This neighborhood is a neighborhood of people that do things together. We're not just a collection of houses of random people. We do things together. My husband and I actually 9 years ago decided we needed to make this even more of a neighborhood, and we started our annual cul-de-sac cookout 9 years ago. We had our 9th one just a few weeks ago. First it was just our cul-de-sac. Now it's down the street. Now it's around the corner too. It's just a backyard cookout where we all get together and get to know our neighbors. That was our point. That's what we're trying to do. When we first heard about this Airbnb, we went to a meeting with Mr. Allen, and there were about 10 families. I'm guessing how many were there, and nobody was in favor of this Airbnb. Nobody wants it to be there. I asked Mr. Allen at the meeting if our opinion mattered at all, and he said, well, I'm here listening to you, but I'm not really sure. I feel like our opinion should be valued because we live it. We are there in that neighborhood every day. Next, Mr. Allen set up a meeting with the owners of the proposed Airbnb, which in our opinion is kind of irrelevant because we don't care who owns the house. We don't care which house it is. We just don't want an Airbnb in our neighborhood anywhere. As I said, we're a collection of people who do things together. We try to make it an old-fashioned neighborhood where people actually get together and we know our neighbors. We know where they work. We know what their families are like. That's what we try to do. On the weekend of May 20th and through the 22nd, a petition was taken around to every single house in our neighborhood. Okay, so that's 138 residences. Out of those homes, 71 people actually answered the door, which is a little over half. Out of those 71, 52 said they were against having the Airbnb. That is 73.2% said, we do not want an Airbnb in our neighborhood. That's a pretty high percentage. 19 had no opinion, did not want to participate, or thought it was fine to have an Airbnb. That's 26.76%. So again, well over the majority, 73.2%, said we don't want an Airbnb in our neighborhood. I do hope you will listen to that, and you have all received the data from that petition, I believe. But I have another question for you too. Would you like to have an Airbnb right next door to you in your neighborhood, where there's somebody new every weekend? Because this house is being rented out right now. There's a new car in that driveway every weekend. Somebody new, you don't know who they are, you don't know where they're from, they'll be gone tomorrow, you don't know anything about them. Now think, what if you had little kids? 6, 7-year-olds playing in the neighborhood, running around the street on their bikes. Again, you don't know who's next door, they'll be gone tomorrow, somebody else there next weekend. To me, as a mother, that's a very scary thought, to have just random people every weekend coming into my neighborhood next door to me. So I want you to really think about that. If you are going to vote yes for this Airbnb, I really would like to hear why you think that's good for our neighborhood. Why is it good for our neighborhood to have an Airbnb? Because I don't think it's good for our neighborhood at all. I think it's good for the owners of the house because they'll be able to rent their house out. That guy lives in New York, this particular one. He doesn't even live in Peoria. So he has no interest in Peoria at all. He lives somewhere else. But for us in the neighborhood, what is it good is it doing for us to have an Airbnb in our neighborhood of people who are trying to be a neighborhood? So I hope you will actually listen to us, our family-friendly neighborhood, listen to us, and listen to the 73.2% of the people who said, We don't want this. Thank you very much.
Thank you. You're still on record. Did you have any other comments?
No, ma'am.
Okay. We're at 22-174. Is there a motion? Councilman Euler?
Thank you, Madam Chairwoman. Move to approve.
Is there a second? Seconded by Councilmember Kelly. Discussion, Councilmember Jensen.
Thank you, Madam Mayor. I just asked this question, that this council to listen to Kathy Matlock and the neighbors that live in this neighborhood. I've been in this neighborhood countless times with my kids, who attended high school not too far away at Richwoods High School. This council needs to start listening to the neighborhoods. That's why we have the special use process. This is not an appropriate place, and the neighbors do not want it there. So I implore the council to consider voting against this. I'm not going to support it, and I hope a majority of the council agrees. Thank you.
You're welcome. Councilmember Euler.
Thank you, Madam Chairwoman. I think it's definitely appropriate for those that have voted no on all of them to continue to vote no on them, but those of us that have voted yes on the majority of them need to do so for the sake of consistency and not show a sign of discrimination that we treat one part of the city and one neighborhood different than the other. And we have maintained consistency with these all the way through the city, and it is not right for us to tell one neighborhood that you don't get them because of where you're located or who you are, but other parts of the city that we're going to approve them there. Thank you.
You're welcome. Councilmember Jackson.
Thank you, Madam Mayor. Just to refresh everybody's memories, we did say that we would look at these on a case-by-case basis, and I think that is what we have tried to do since I think it was Councilmember Graham who suggested that. And so I would have to say that I respect the wishes of the individuals who live directly in that neighborhood and who are going to be impacted by that. So after having listened to the resident tonight, I will not be supporting this. I have to respect the wishes of the individuals coming out of that neighborhood. That is how we said we would make decisions, case-by-case basis. If the majority of the people that live there say no, then we have to listen to those individuals. Thank you.
You're welcome. Councilmember Kelly.
I'm not strong on this, but once again, it seems to me that if someone has followed the rules that we have set, that gets them onto about third base. Beyond that, I've driven by this house a couple of times. It's a beautiful home. It's been a B&B. They're trying to bring themselves into compliance. It's been a B&B, I guess, for some time, or a short-term rental for some time. There apparently haven't been any problems. So I'm inclined to approve it once again, I'd just like to put out a position that I have of arbitrary law. When we make up law every time we consider something, no one knows what the rules are. It seems to me that good, bad, or indifferent, we need solid rules of the game. And if somebody follows the rules of the game, then they're in. And this way, we make it up as we go along, and I don't think that's good law. Thank you, Madam Mayor.
You're welcome. Any other discussion? Please cast your ballots. Motion passes with 3 nays, Graham, Jackson, Jensen. Madam Clerk.
22-175 is a communication with request to concur with the recommendation from the Planning and Zoning Commission and staff to adopt an ordinance approving a special use in a Class R4 single-family residential district for a short-term rental for the property located at 1709 West Sherman Avenue.
Mr. Manager?
Thank you again. I'll turn the floor over to Director Doolin.
Okay, Director?
Thank you, Mayor. Thank you, Mr. Manager. Staff would ask council to defer this to the second meeting in July with the condition of referring it back to the Planning and Zoning Commission for amended application. The property originally came through the Planning and Zoning Commission as a single-family residence, but after some further investigation, there may be more than one unit at the building, and so we need to amend the application at the Planning and Zoning Commission.
Okay. Council Member Jensen?
Thank you, Madam Mayor. I move to defer this item to the second meeting in July.
Seconded by Council Member Ruckriegel. Any other discussion? Please cast your ballots. Motion passes unanimously. Is there any other unfinished business? Madam Clerk?
We are at new business.
Councilmember Euler?
Thank you, Madam Chairwoman. It was recently brought to my attention that we have a job posting 2022D-10 for the city of Peoria for an SNET manager. Whether it be tonight or at the next meeting, I would like an understanding of exactly what that is and what we're doing here with this committee in hiring staff to provide to a committee that we have absolutely zero oversight for. This is very, very concerning to me.
We can put it on agenda to provide a SNET presentation. Okay. Okay. All right. There you go.
Just as a reminder, that SNET manager position was approved in the budget by the City Council.
Yes.
I didn't vote for the budget.
Councilmember Allen?
Thank you, Madam Mayor. Friendly reminder that this weekend is the Peoria Juneteenth Fest down at the Carver Center from 11 to 6 p.m. It's going to be a good time. A lot of vendors, food, different speakers will be presenting as well too in honor of Juneteenth. So if you're looking for something fun to do to celebrate Juneteenth, learn more about the holiday, please head down to the Carver Center between 11 and 6 p.m. this Saturday. Thank you.
Okay. Councilmember Ruckriegel?
Thank you, Madam Mayor. Just to note that, or as a reminder, today is Flag Day, and today is Flag Day, and one of those we often forget. But down at WTVP, in a partnership with Peoria Historical Society, they have an exhibit that will be open over the next couple of weeks on flags, and it's a wonderful exhibit. Recommend that everybody take a couple of minutes out and go through that, and it's great partnership between the two organizations.
Thank you for that. I saw all those flags at the county courthouse flying today. Valpula?
Thank you, Madam Mayor. May I request the city manager to give a report back on the economic development funds that we allocated, and what did we allocate for, what was accomplished. It's half of the year, so I just wanted to see. Thank you, Madam Mayor.
You're welcome. Okay, Madam Clerk?
We are at citizens' opportunity to address the City Council and Town Board.
Okay. The first name I have is Peg Pendle. I don't see her here. Okay. Shantae Means.
I would like to ask Mr. Police Chief, where's Lexus is the concern? And where the concern is, where's missing Lexus? And do you need help finding Lexus? Accept help from the Nation of Islam and finding Lexus. That's it.
Okay, Ms. Means, you can make comments.
Oh, great. That's the comment. Thank you.
Okay, thank you. Mr. Walther, Dan Walther.
Good evening, dressed for the weather. My name is Dan Walther. I'm a candidate for District 2 School Board, and I've juggled 2 city council meetings tonight, one in West Peoria, and this fine meeting here. I appreciate it, Mayor. One of the things, and I've also learned a lot by being at this meeting, is that I think we need to have, whether I'm elected or not, I think there needs to be more discussion and communication between District 150 School Board and this body. There are too many issues that were brought up tonight here that I think we can't neglect. First one, I think, is city safety and school safety. I was in Florida 4 years ago when Parkland happened. It had an incredible impact on me, and what's happened lately in Texas is the same way. I think we have to work together to ensure the safety of our students in school and out of school. And I think the one way to do that is for us to meet on an improved basis than we're doing right now. We've discussed here violence. You discussed the program that you've got going with that. I think we should be part of that discussion. That should be a thing that we should be involved in. The other thing that we talked about here, and you talked about here, and some very interesting programs, one of which you wanted an intergovernmental relationship. Well, that would be us being part of that. And so home ownership is critical. I think that is very important. We want to do things to encourage home ownership. That helps District 150, that helps Peoria, that helps make us a better place to live. The other part I wanted to discuss with you, I have been supported by the West Central Building Trades Union. I have been endorsed by the Peoria Federation of Teachers, the Peoria Federation of Support Staff. And one of the things they did is I had to fill out a questionnaire to gain their support and answer some questions. One of the questions they had that was intriguing was, Mr. Walther, you as a board candidate, what could you do to raise funds for District 150 without raising property taxes? Interesting question. And so I went back and started going through the issue. We have a gentleman by the name of Terry Knapp, who about every other meeting brings up the fact that the city of Peoria has not shared a penny of riverboat money with District 150. But there are a couple of other sources of income that are coming in, some of which I know you can't officially discuss, but we do have a legalized marijuana office that's here, and they have made considerable amount of money from what I've heard. I don't think even under a FOIA I could get that. And the second issue is that the state of Illinois has legalized gambling. And in trying to find out how much has been dispersed to the cities, so far I've been able to find, I don't think you've received any yet. I don't know, Mr. Eric, if that could be in here. But I think there should be some discussion, because I don't want to be here 25 years from now saying, we never got a dime of that money from the stuff with it. I think there should be maybe some sharing of some of those things. And even if we use the sharing of that money for school safety or some other combinations, I think we should have those discussions. I appreciate the work and the time that you guys do here. I understand that as an elected board member too. But I think the more communication we have, the better it is for all of us. Thank you.
Welcome. Next, we have Kristen Meercourt.
Good evening, everyone. I actually came here to speak on a completely different topic, but the whole cure violence thing kind of brought more attention to me. So I have no speech planned out. I'm sitting here taking scratchy notes real quick during the meeting. I noticed one council member saying over and over about how they spoke to the constituents and saying that they were using their taxpayer money for this. That is not true. All right, this is from the American Rescue Act. It is a grant. It is not our taxpayer money that is being used for this. And I think getting accurate info into the communities is going to help them understand better. So I think this was earmarked for gun violence prevention. $25,000 is a drop in the bucket. I serve on East Bluff Community Neighborhood Association. I'm the president. Jesse McGowan is our treasurer. So we've had this discussion back and forth because I had a lot of questions. He has a very, as always, firm stance on what he believes in. He's very passionate. I still had a lot of questions. But tonight, some things just, were bothering me. So I'm going to say them. Number one was the inaccuracy on the, that it is not our taxpayers' money being spent. It's the American Rescue Act grant that was given for the prevention of gun violence. Also, public health crisis. It was brought up this evening that this is not a public health crisis. How could it be? Except for the person that is shot or stabbed or who the act occurs with. But it is indeed a public health crisis when an act of violence does occur. It affects the mental health. It causes trauma, not only to the victim, if they survive, to their families, to their neighbors, to our entire community. If that trauma goes unaddressed, what is going to be the outcome? More times than not addressing that trauma, and I know this from work that I do, it leads leads you down a road that maybe you don't necessarily want to go down in life. And then there you go, spinning like a hamster on a wheel. We're not getting anywhere. I do know that Mr. Graham had said, why do we need a company to come in and tell us what we already know? I had the same question until I researched some more on it. My question is, if we already know this, why hasn't something been done? Why hasn't this been addressed? We know what the issues are. Yes, we do. Do we have the answers? No, we don't. We know what needs to be done, but we do need to look at this further. I am 110% behind Cure Violence. It's $25,000. This is not another survey. We've thrown so much money towards surveys in the past few decades. This is an assessment, and it has a proven good, great track record. Why are you so opposed to it? It's money that is earmarked for this. And I'm going to just stop there, but it's, I did hear one member say that they were even unsure that Peoria PPD supported it when Officer Hodges was sitting back there. The chief is right back there. He supports it. I'm not going to get all riled up. I've got 24 seconds left, but I just want you to rethink, and if I can do this and educate myself with as little time as I have in my life, with all the things I'm active in, I think that you should be able to look up these issues and further educate yourself too. And again, it's not taxpayer money that's being spent. Let's save our community.
Thank you. Mr. Sincere Williams.
So this is my first city council meeting. I do feel a little underdressed, but that's okay. Next time I'll come in here with a fancy suit like a model. So I wanted to just reiterate some of the things that the Director of Epidemiology and the Public Health Administrator was saying. It was mentioned in this meeting and previous meetings, suggested that we redirect the funds from this and put it towards the police department, other organizations, et cetera. But this money is for the assessment, and the assessment is necessary for implementation. And so echoing what, a lot of us have been saying tonight, this assessment, the program works. It's been proven to work, and Cure Violence stops violence before it happens. And while I think the Peoria Police Department has made great preventative efforts, the Peoria Police Department, it still stands that police are typically called after the crime happens or while it's happening. So while they've made great preventative efforts, that law enforcement combined with this proven preventative program, combined with individuals in the community who know the community and are out there, it's almost inevitable that it's going to work for Peoria. And if this program can work in major cities and states across the nation, I think it can work for a little Peoria, Illinois. Also, for this program, there are going to be interventionists who go out into the community, and in doing that, they're going to find that there are other needs, such as housing insecurity, food insecurity. And when you're looking at those social determinants and you connect those things to social services, that's also been proven to reduce violence. So that, is something that comes with this. And again, combined with the efforts of law enforcement and individuals in the community who care. But yes, Mr. Graham, still do need to collect a check because we need money. I think this can work for Peoria. Also, by combating violence in the city, I think it'll give us a chance to focus on other issues, a plethora of issues that, you've all discussed tonight, but the current rise in hepatitis C cases among older people in Peoria right now, the homeless population, the strange pediatric hepatitis cases emerging all over the country right now that, if we don't know, has hit Peoria, could very soon hit Peoria, considering there are cases in the Midwest, monkeypox, and then obviously other crime. We can focus on nonviolent crime with this initiative, focus on it more closely. Also, this program looks at violence through an epidemiological lens, and to my knowledge, the city hasn't looked at violence that way, so I think, again, this combined with what we're already doing is really going to help. I'd like to give an example. I do outreach in epidemiology at the Peoria City County Health Department. I'm also employed at the Urban League, and correct me if I'm wrong, one of Peoria's hotspots. So I'll just move into my example. For the health department, we recently had a woman who was diagnosed with an STI, and one of our disease specialists, in speaking with her, found that she needed all of these other things. And so as a community health worker, she was connected with me, and I was able to connect with one of my organizations outside of the health department to get her clothes and food, and she was still able to get treatment for the STI she got. It takes multiple interventionists to, make this work. We can't just forget the assessment, throw the money to the police department. I'll speed this up, I'm running out of time. So I guess I would just like to end with, it was mentioned that alternatives weren't heard for this program, and I understand that, and if that's true, I agree, you need to hear all of the options and hear the alternatives. But I feel like this, Kristen was saying, this isn't money that, correct me if I'm wrong, isn't being pulled out of the city but comes with the American Rescue Plan. It's a proven model. I feel like we're being handed something on a silver platter. What are we doing? The chief of police endorses this, the director of epidemiology, the public health administrator, the key players are in support of this, so let's get on board.
Thank you, Mr. Williams. Madam Clerk?
We do not have an executive session, so we are at adjournment.
Can I get a motion to adjourn, moved by Councilman Allen, seconded by Councilmember Jackson? Please cast your ballots. Thank you for your service.